evening and welcome to our school committee meeting of Tuesday, August 24th. We are meeting in person, but people are also here via Zoom. I'd like to call this meeting to order, and we will start as we always do with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'm going to read our mission statement. The vision of the Wakefield Public Schools is to graduate students who are confident, lifelong learners, who are respectful and caring members of their community. Our mission is to prepare students for college, career, and community by providing rich and challenging curriculum, high-quality instruction, and educational experiences that meet their individual needs and interests. So we're at public comment. We've got some folks in the studio with us, but it looks like only one of them has signed up to speak. Just to set kind of some ground rules, we generally give people about 3 minutes to speak. If you need to go a little bit over that, that's fine. We don't generally respond. We're just here to listen. And if any of you change your mind and you want to speak, now is the time. The rest of the meeting is not open for kind of public discussion. You're obviously welcome to sit and observe and listen. So we will start with Frances Taylor. No, you can come up to the table. And if you can just give us your address, because we've got your name, Frances Taylor.
Yes, I'm Frances, but I'm also known as Chickie Taylor. Yep. And I live at 9 Old Nahant Road. And I just have 4 quick things, jotted them down before I came. The first thing is back in July when I came to one of your meetings, you were all there, and you sat there for I don't know how long, but none of you had masks on. But we want our children, and by the way, I don't have children in the school system, but I'm standing with them because I do care about them, and I do have granddaughters. But you all sat there with no masks on up on the 2nd floor at the Galvin School, but you want our children to sit there all day with masks on. Number 2, are we going to treat this like the thing with the logo? We're only going to stand for one side instead of all children. Number 3, when are we going to decide to stand for freedom for everyone, not one side? Are we willing to throw away our children's freedom under the guise of medical tyranny and use our children as pawns to get to the parents? Because that's how I see it. You can't get the parents to do something, we'll get it through the children. I call that pawns. And number 4, lastly, listen to the other side of the science instead of one side. Because there's plenty of it out there, but you're not going to find it on CNN. You're not going to find it on mainstream media. You have to go on a place like Telegram and start looking what the doctors are saying. There's 2 sides of the science, and both sides need to be heard, just like all children matter, not just masked ones and not just vaccinated ones. Thank you all for listening.
Thanks, Chickie. Anybody else in here? State your name and address, please.
Mike Schwartzberg, 45 Greenwood Avenue. I just want to say there's no tests showing that. There's no scientific evidence. There's nothing showing the masks do anything. So unless you're coughing on someone, yes, you wear a mask. Wear a mask in surgery. I mean, the virus is so small, it goes through the mask. Like, you guys do some more research, not you generally, just people in general. Thanks. Have a good day.
Thanks, Mike. Anybody else? Yeah, no worries.
Hi, I came unprepared, but Marisa Luongo, 17 West Park Drive, right here in Wakefield, and I am passionate about this, just jumping in. I don't have children in the school system right now, but I have nieces and nephew. That being said, from what I hear and see, they're traumatized about going back to school. Now the 5-year-old, I have a sister who has 7 young ones, 8, but 16 and down, 7 of them going back to school, not in this, they're from Medford, but still they're having to hear this one, that one, and having to see what they're all going through. And I just think it's so traumatic, and so, this has been so politicized, and it's, to me, so ridiculous that children have to suffer through this. I feel it's inhumane, it's un-American, and it's unnecessary. They, it's okay, we're sitting, we're okay without the mask. Standing, you need a mask. I mean, we all know that's a joke. I'm sorry, I think most people should. I'm a nurse. I see what I see in a hospital too. It's a joke. It is what it is. We're all just human beings having to play some game. Some people are terrified of the virus. I respect that. I had the virus, sorry. I had it early on. I'm not terrified of it at all. I think herd immunity. But that all said, so that's all I'm gonna say is I'm concerned about the mental health and well-being of our children. I think they don't see their beautiful smiles. It's unnatural, it's abnormal, it's sick and twisted. And I'm not blaming anyone here, but I just hope that people in America, we should all, if this isn't Democrat, Republican, I'm an independent, I'm 65 years old, I've never seen anything going on in this country the way it is right now. It's tyranny, and it's frightening me. That's it, thank you all.
Just have a quick follow-up, can I just yell
Come on
from
up. Nope, come on up.
Mike Schwartzberg again, 45 Greenwood Avenue still. Who do you all answer to? Who do you need to tell that we don't need to wear masks? Who's telling you to make us wear masks for the kids? Who are we answering to? Who are you answering to? You, the school board, director of health, board of health. That's the name I want, and that's who I'll talk to. Thank you.
Dawn Millward, 18 Emerald Street. I have 2 children, 8th grader and a 6th grader, one vaxxed, one unvaxxed. I wasn't going to speak tonight, but I think it's important to have voices heard. I did write a lengthy letter to you guys today that a lot of thought and effort went into, so I'm looking forward to some responses from you guys. My understanding is that children are going to be sitting, eating lunch together this year at a small table, unmasked, next to each other, less than 3 feet apart or whatever requirements are this year. But again, we're gonna go into the classrooms, which we are more spaced apart, requiring our kids to wear a mask. So I just don't understand, we're sitting, laughing, eating, chewing food, and no masks are required, and I know we can't eat wearing a mask. I'm sure if we could, we would by now. But why are we going into the classroom further spaced apart and still requiring our kids to wear masks? I think come October 1st, I wasn't surprised by the ruling today by Riley. I felt that was coming, but we keep, what is the difference come October 1st? I think 77% of the high schooler kids are vaccinated, and we need to get to 80% or we're still all gonna wear masks. Like, those kids already have the availability. There's no excuses for that group of children, adults, not to be vaxxed. So there's not gonna be a huge amount of those children going to be vaxxed. They would have already done so by now. So theoretically, we're probably never gonna get to that 80%. So what are we doing after that? This should not be the new norm. We've done this for over a year. There has to be something. If you're not feeling comfortable or safe, wear a mask. If the kids and the adults that got vaccinated don't want to wear a mask, that should be a choice. We can't live in fear the rest of our lives. This is a virus, it's the variant, it's gonna mutate, it's gonna change, just like the flu. The flu is always going to be here. This year I got my children the flu vaccine because I was told they couldn't come to school if they didn't have the flu. A week later, they changed their minds, and now my kids got a flu shot that I normally don't do, so they could come to school. I think come October 1st, it's really important that this team, school committee members, come again and really think, what are we doing for our children? But I don't want to see my kids masked all day. It's not fair. So I appreciate your time. Thank you for all of your time and commitment on this board. But yeah, I really hope come October 1st, you're discussing different opportunities. Can kids, when they're sitting in their classroom, chin their masks when they have to get up and walk to the bathroom, walk to their specialist, put their masks on? But if we're saying it's okay to sit in a cafeteria right here next to someone, laughing, chewing, coughing, sneezing, but then we're back in our classroom further apart, it doesn't give. You can't have it both ways. Thank you.
Thanks, Donna.
Good evening, everyone. Carrie Moore, 49 Woodcrest Drive. So I had no intentions of speaking tonight. This totally goes against all of my type A personality to be unprepared for speaking engagement. But I was inspired, I have to say, by standing out on the sidewalk today, and I was expecting to get more, people yelling, and we got a ton of beeps out there and a ton of support, and there was no one signed up on the list to speak, and they were like, Carrie, you need to speak, and I was like, nope, not doing it. But seeing all of you stand up, and I appreciate it. And I think I just want to say what's disturbing to me is that when you all went to change the logo, you did a survey. We sent it out to all the alumni. Anyone I knew got it. I forwarded it out. My aunts, my uncles, my godfather don't live here anymore, but you wanted to hear their voice. And you put a panel together, and it was for and opposed, and it was great conversation and allowed us to hear both sides of things. And that dialogue isn't happening for this. And there is a mental health piece of this. There is the fact that my daughter's in 2nd grade, and she's learning to read, and she can't hear sounds. She's working with my aunt, teaching her how to read, and she's had to kind of recreate how to make sounds because they can't see her mouth, and those are lasting impacts. I mean, I'm in the workplace, and I've had years of being able to talk face to face. They haven't, right? I know how to read people's emotions. They're getting just eyes, and this is their foundation for life. And I think when you look at the Delta variant, the death toll in children hasn't changed in the last month and a half. It has remained at 354. And I think we have to ask ourselves, what is the impact to these kids of the virus versus what are the long-term impacts of them wearing a mask, not being able to see faces, engage with their teachers. So, thank you for allowing us to be part of the dialogue today, and I look forward to continued conversation. Thank you.
Thanks, Carrie. Anybody else in studio? Okay, on the Zoom, I know we have Sherry Lieber. I can see you, Sherry. Sherry, if you can say your address, please. Can't hear you. I think she's unmuted. Is it a studio thing? Sherry, hold on a second. The WCAT guys are trying to figure it out.
Try again.
Sherry, if you can try again. Still can't hear you. Hold on a second. Sherry, go. We're getting an echo in here. Sherry, try now. Still. Sherry, try now. No, we still can't hear her. vaccine feature, then the WCAT folks will cue you in, assuming that we get this audio fixed. Do you want her to try again, Ryan? Ryan, Sherry, if you want to try again, you're on mute at the moment. So I think we have to unmute her.
Can we unmute her? Or does she?
Yeah, we.
Okay.
Sherry, if you want to try now. Oh, they just muted you again. Still can't hear you. We can see your lips moving. Oh, and she can't hear me.
Start of COVID and
Oh, Sherry, can you
I'm
start?
looking forward to having in-person classes with some sort of normalcy so I can hopefully have a high school experience
Can't hear me.
that is safe and challenging academically. Face masks work. They keep us all safe. I'm vaccinated and still wear a mask as I don't want to unknowingly transmit the Delta variant to a student at my mother's small business, teaching young students who are not yet eligible for any vaccines. You never know what someone's home life is like and why they make the decisions that they do. I want to try different activities as a 10th grader at our high school. This can happen if we are safe and masked. Please support continued masking as long as it is necessary for us to all remain safe and keep the environment safe for those students and teachers who can't get the vaccine for medical reasons. Thank you for listening.
Sherry, can you hear me right now? I don't think she can.
Dan the text asking if she could. Right.
I got it. I know, seriously.
Thank you.
I would like her to try again if she can. I just sent her dad. Oh, I think she's good.
Hi,
There we go.
and thank you, Chair Bayer. My name is Lieber. I'm in 10th grade, and I ask you to support having face masks in school as long as necessary to limit the spread of COVID and the Delta variant. I became a remote student last year, and I am looking forward to having in-person classes with some sort of normalcy so I can hopefully have a high school experience that is safe and challenging academic. Face masks work, we know this, and they keep us all safe. I am vaccinated and still wear a mask as I don't want to unknowingly transmit the Delta variant to a student at my mom's small business teaching young students who are not yet eligible for any vaccines. You never know what someone's home life is like and why they make the decisions they do. And with all due respect, students can't learn if they are on ventilators. I want to try different activities as a 10th grader at our high school. This can happen if we are safe and masked. Please support continued masking as long as it is necessary for us to all remain safe and keep the environment safe for those students and teachers who can't get the vaccine for medical reasons. Thank you for listening.
Thanks, Sherry. That time we got it all. WCAT, do we have anybody else that had expressed interest in speaking?
I'm not entirely sure. We can go check for him.
Okay.
We may have
Oh, if Hannah Federici was on?
I'll check to see if she's in.
Okay.
Nobody's got a hand raised.
Okay. Then I think we're going to go ahead and move on. Thanks to everybody that took the time to speak. Next on the agenda, my agenda's gone. is the consent agenda. Mr. Markham?
Yes, thank you. I move that the school committee approve the minutes of the July 31, 2021 school committee retreat and the minutes of the August 10, 2021 school committee meeting, and to accept the minutes of the August 5, 2021 school committee finance and facilities subcommittee meeting as presented.
Motion made and seconded. All in favor? All opposed? Okay. So I have a very quick update regarding our yearly, I think this will be the third time we will have had a tri-board meeting where the Finance Committee, Town Council, and School Committee gets together. We got an email from Stephen Mayo about scheduling that for October 21st at 7 p.m. Actually, they want to present the tri-board as a Zoom meeting, so we don't need a location. So I just wanted to get that on everybody's calendar. Again, it's October 21st at 7 p.m. I will send that out via email too, but I just wanted to mention that. And that's all that I had. So, Mr. Lyons, I'll pass it over to you for your section.
Thank you so much. I'm going to take my mask off just to make some remarks. So just comments and updates. We are in week 2 of our Acceleration Academy, where we welcome back our kindergartners. We have over 60 8th and 10th graders participating in the Acceleration Academies for math as well. So that is going really well, really pleased to be able to offer that. That is a grant-funded opportunity. It's hard to think that we can move forward without continuing kind of having our kindergartners in early. It's been really fantastic for us. Other updates, next week on the 30th and the 31st, the end of August, we welcome back our new teachers in our WPS induction program that is directed by Liz Doucette, our director she handles our new teachers and welcoming them on board. So that's on the 30th and the 31st. On the 1st and 2nd are our first days for teachers. And so we're very pleased to kind of get back at it. There's 2 professional development days, and those days are broken out broadly. So there's time for teachers to set up their rooms, but there's also a little time for us to welcome teachers back and do some professional development. So just other comments and kind of good thoughts we'd like to send out to Principal Matt Carter, who at about 4 a.m. last night finally welcomed his daughter, Ella Joan, his 3rd child, to his family. And so we're really pleased to welcome Ella to the Wakefield family, and congratulations to Matt and his wife, and best to his family. Very happy to hear that. It's been a kind of a week of back and forth to the hospital, and we're pleased that has finally happened. So I'm going to go to item B, which is our reopening plan. And so this is about 16 slides in total. We will post this to the WPS website tomorrow. We will also send a link out to parents where they can access this information as well. So in regard to opening, I'd just like to start off by saying, we have learned a lot in this past. I don't know if you can, I hope you can still hear me well. It's a little echo here in the studio. So we've learned a lot in the last year. So some of the things that you're going to see in this reopening plan are similar to last year. Some of the mitigation strategies are different. And I think some of the differences between last year and this year reflect the departure in our ability to really kind of be more progressive or more active in creating learning environments that are different from last year and different from the schedules that we had last year. So our goal is to create and prioritize in-person learning and to get students back into full schedules similar to what we had pre-COVID. So that's an important piece. We also want to be safe as we move forward. So the agenda for this evening is to talk about the mitigation strategies that we are going to put in place that will include monitoring symptoms, that will include vaccinations, masking, social distancing, isolation and quarantine, COVID testing, support for students, work that we're doing in facilities, as well as communication. So first up, we again are going to continue with the mitigation strategy of asking parents, teachers and staff to kind of do kind of a daily check and make sure that they are not kind of demonstrating any of the symptoms on this list. This is not different than information that we shared last year, and we will get this out to parents again. But we're simply going to ask.
Can you change the slide?
Sure. Sure, but we're simply going to ask that parents again attend to this list. This was one of the things that really worked well for us last year. If you're not feeling well, if you're demonstrating these symptoms, we're going to ask that you stay home, right? When in doubt, please just check in with your school nurse, and they will be able to direct you and provide you any guidance or support that you might need. So vaccinations. Vaccinations are kind of the leading way or leading strategy to curb and stop the COVID pandemic. It's been said many times, and I agree that I do not believe COVID is going away, but vaccination is a strategy that will help us to lessen the symptoms and the severity, lessen hospitalizations, as well as the more acute, effects that can come with it as well. So a game changer for us is really the Delta variant, right? So the references between, summer and as we go into the fall in our planning is really the Delta variant. We know that it's more contagious than the original virus, and our vaccination rates in Wakefield are really exceptionally good. But the way that DPH kind of gives us back the information, they give us back in age bands. And so we have a 12 to 15-year-old age band and a 16 to 19-year-old band. What we really need to do is break out that information and have kind of a year by year, because our 18 and 19-year-olds, we don't know if they are reflected in regard to students that are going off to college who may be required to get the vaccination, which might skew our data. And we're really going to need to look at the DPH information as a prompt, but in being very optimistic and positive about the information that's presented, our vaccination rates and our COVID coverage in Wakefield is really good. And I think it was shared this evening with some of our speakers who spoke earlier. And so in terms of masking, we have worked with our local Board of Health. We have referenced the CDC guidance. We have also worked with other districts and have taken feedback from the Department of Elementary and Secondary Ed. We've created an updated mask policy for Wakefield. And so we feel like masking in grades pre-K through 12 and post will really help us be safe. So we feel like masking is a mitigation strategy that really works, that will also help us with learning models and allow students to be closer together if they can be masked for part of the day. So there's a public health order that all students are required to be masked on buses, just for reference. So the Department of Elementary and Secondary Ed this morning met, and Commissioner Riley, the Commissioner of Education, asked his board for approval, for statutory approval, to use the CMRs and the regulations in Massachusetts to create a mask mandate that will be in place for all students K through 12 at least until October 1st. Now, they could reissue after October 1st, depending on the spread of the virus or for safety reasons. But right now, they're hopeful that things will change by October 1st. And one of the mitigation strategies, or one of the things that they're looking at, is kind of vaccination rates. So that different kind of percentages have been passed around. At the federal level, we've been told, or the number that's been passed around is 90%. At the state level, a number that's been passed around is 80%. So we will be kind of working with our students to really drill down to get an actual percentage of not only our students, but our faculty and staff as well. Because the entire ecosystem has to be taken into account when we're looking at percentages. But with that said, everyone right now is under a mandatory mask mandate, K through 12, per the state. So social distancing. So the guidance that we've gotten this year is a little different than last. Go ahead, Mike.
This slide. Do you want to give me that, and I'll do it?
Good. We got it. Thank you. So social distancing. So the guidance that we've gotten this year is a little bit different than last, okay? And so this year, the Department of Elementary and Secondary Ed has said in order to get students back into school in full schedules, that social distancing is not required, but their guidance is it should be when possible, right? So we know for students to learn effectively that they need to be in close proximity to one another. Learning is a social activity, a social event. So at the elementary level, we will be teaching students in clusters. So they're going to be at their desks, but they're going to be clustered in small groups so that instructionally we feel that that's the best way for them to learn. And it also gives us an opportunity, if there are close contacts or if there is a positive case, that we can identify close contacts in clusters, okay? So, but a change in regard to the state being a little bit more aggressive with social distancing is that they're saying that to go to our cafeterias and to eat, they're asking students to lower their masks, eat, and then raise their masks again and kind of go on about their day. We will also be working with our principals to create space where we can. So, for example, at the elementary level, we'll be adding some seating around the perimeter of cafeterias. We'll be getting kids in. The kids that are in first might be going out to recess more quickly if the weather will allow, or if we have space to move people about in buildings. Obviously, at the secondary level, that's different, right? And so, for example, at the high school, we have the field house that we can use, and if the weather will allow, we can get students out onto the turf for lunch as well. And so the other piece that I want to, again, emphasize, that the masking mandate is while we are inside, not outside, which, again, is different from last year. Isolation. Carrie, you want to talk a little bit about isolation?
Sure.
Can you hear me, Carrie?
Oh, Carrie.
Not Carrie. Carrie.
That actually saved
Did
me
it scare you?
because I was not prepared to speak to that.
I'll take it, Kara. Okay, so isolation guidelines are something that we have had in effect since basically we started with COVID. Those have not changed since then. So if you are tested positive for COVID, then you will isolate for 10 days. Isolate alone in your room, preferably with no contact with other people. Typically it's 10 days as long as your symptoms have significantly reduced. If you are asymptomatic, it still remains, you test positive, you isolate for 10 days. If you're a student that chooses not to test when you're in school, you may have symptoms that could be COVID but choose not to test, you would also isolate for the 10 days. As long as your symptoms have greatly improved or are gone, then after the 10 days, you are out of isolation. So that's isolation kind of in a nutshell.
Carrie, before you move to the next slide, I would just like to introduce you. So this is Carrie. She is our school nurse at the Galvin. So she's one of our 2 school nurses at Galvin, but she's joining us this evening just to talk about the next few slides: isolation, quarantine, and close contacts. Go ahead, Kara.
Okay, so quarantine. Quarantine is going to be a little bit different this year than last year, especially now that vaccination is being taken into consideration. So if you were a close contact and need to quarantine, there are a few options. If you choose not to get tested, for the virus, you would quarantine for 10 days as long as you have no symptoms. And after the 10th day, on the 11th day, you can exit quarantine. If you choose to get tested on the 5th day of your quarantine and you test negative, you have no symptoms, then on the 8th day, you complete 7 days. And on the 8th day, then you can exit quarantine. There are some exemptions this year. There will be if you're fully vaccinated and have no symptoms, you are exempt from quarantining. If you were in a classroom and the class was 3 feet apart, you in the classroom setting only, the 3 feet is only for a classroom setting. You would not need to quarantine. And also on the bus this year, if you are masked and the windows are open on the bus, there is no need to quarantine. And also if you have had COVID in the last 90 days, you would not need to quarantine. So there are some more exemptions from quarantine now that we did not have in the past.
Thank you, Carrie. Can you, yep. Close contacts?
Close contacts. So a close contact is defined as someone that was within 6 feet of a person for 15 minutes or longer during a 24-hour period. Inside, this does not include the outside setting. This is indoors, and this is masked or unmasked. So even if you were masked at 6 feet, less than 6 feet, you are still considered a close contact. So then you would be considered a close contact, and then you would need to go through the quarantine process. The at-risk exposure time for someone to become a close contact, if someone 48 hours before their symptoms present themselves, or 48 hours before they test positive for COVID if they have no symptoms, is when we start looking for close contacts to that person. And then the close contact period would end when that person goes into isolation. So anytime between isolation and 48 hours before they develop symptoms or test positive if they don't have symptoms would be people we are looking to deem as close contacts. Close contacts could be notified in different ways depending on how it's discovered. The Board of Health usually is aware. School nurses may notify families, and school administration could be involved in notifying families depending on the situation that arises. And there are protocols for the isolation and quarantine, and there's a link in the slideshow that goes into a 12-page document that breaks down all of the guidelines.
Thank you very much, Carrie.
Doug, does it make sense for us to stop here to ask Carrie any specific questions that we
Sure.
have on these pieces?
That'd be
I
great.
just don't want to get too far along.
Yeah.
Go ahead, Amy.
I have a question for you, Carrie. So if after, and I'm not sure if you said this or not, if after 2 weeks, if a child tests positive and they're still testing positive after 2 weeks, can they still come back?
The guidance from the Board of Health
Oh, we
is
can't hear you.
if you test positive. You can't? Ooh, I'm not on mute.
No, you're good. Now we
Can
can.
you hear me now?
Yep.
Yes.
Can you hear me now?
Yep, we're
Yes.
good. She can't hear us.
Oh.
She can't see our thumbs
Can you
up.
hear
either.
me?
Yes, we can,
Yep.
Kara.
Yes? Okay.
Yeah.
Sorry. So when someone tests positive, the recommendations from the Board of Health are that they do not need to test again. They just test positive and then they do their 10 days in isolation. And as soon as they're feeling significantly better for 24 hours, as long as they've met the 10-day minimum, they can exit isolation. So they do not need to get a retest to have a negative test to come back to school.
Carrie, just a clarification. At 10 days, you have to be symptom-free as well. Is that correct?
Not completely symptom.
We might have just
You don't have to be completely symptom-free. Some symptoms can last. Loss of taste and smell can last, as many people know, for months and months.
Yep.
If you develop a cough, sometimes that cough can linger. So the guidelines are a significant reduction in symptoms, including no fever for 24 hours
Yep.
before you're released, as long as you meet that 10-day minimum.
Any other questions?
Oh,
Yeah, Aim?
Well,
so this list is long.
And these
And these
symptoms can be a common cold. And I felt like last year, well, I know because we experienced this, that if I would email the nurse being proactive, daughter's not fit, well, you have to get a test to come back. And then when I got the test, they're like, well, that wasn't the right test. You have to get the certain test because the rapid test didn't count. And so I didn't know if we were going to make a flow chart again and like list what tests are acceptable and what aren't. And given the looser guidelines that kids are going to be closer together, I feel like a lot more people are going to be in quarantine than they were last year.
So I can talk a little bit more about that.
Oh, okay.
Yeah, I don't know if you have any questions for Carrie while she's with us.
The test at home now is available. How are we going to?
That's my slide next.
Oh, that's your next.
Yeah.
Am I like way?
I think you're ahead of us.
These guidelines, are these Board of Health specific to Wakefield, or are they taken from the state?
For,
Like the quarantine and the isolation.
so those are from, they came from DESE.
Okay.
Yep.
Okay, thank you.
So there's a link in our slides, and I can certainly get you that information. You can just click on it and go to it, if you have it electronically. Looks like you have a paper copy here.
I like paper.
That's all right. I can get you whatever you need.
Okay.
I did have a quick question for Carrie.
Yeah.
Carrie, the scenario that you shared of someone who's vaccinated and not symptomatic, it didn't sound like they had to quarantine at all. Do they have to show a negative test, though, to be able to come back, or no? We can't hear you. Hold on a second. We need the,
I'm not on mute.
Yep, there you go.
Can you hear me now?
Turn you back on. You're good.
Okay, so if you are vaccinated and have no symptoms, there are no requirements for you to do anything if you're a close contact. You don't have to get tested. There's no requirement for that. You may choose to get tested, and that would be a scenario we would handle with families. But there's no requirement to get tested unless you develop symptoms. If you develop symptoms, you need to isolate and get tested just like anyone else would.
Okay.
Does that answer that?
Go ahead, Amy.
How do you know which students are?
Oh, we can't hear you again, sorry.
We can't hear you.
Yeah.
We need WCAT to turn them back on.
Can you hear me now?
Yes. Yes.
Okay. So we would handle each case. If we had a situation where students were in quarantine, we would reach out for documentation from the family about if their child was vaccinated or not, to give them the guidance. And if we had documentation that their child was vaccinated, then they would be exempt from the quarantine. So we would be requesting that mostly from the families at this time. There is a Massachusetts immunization system that we have access to. From what I've read, we are able to access that for COVID vaccinations, but I would defer to someone above me before I would just say that's how we're looking for vaccinations. Right now, I think we're definitely gonna, request them from parents per situation.
Go ahead, Mike.
Status without permission?
If it's a required vaccination that you're required to go to school, and you have not requested that you do not want your child's information shared, then it goes into a database that we are able to access. That does not violate HIPAA because it's state mandated vaccines to enter school.
Okay. But this one's
So
not
this is
considered.
Mandated right now.
It is or it isn't?
That's why it's a little different, but the state mandated vaccines, we are able to access that system.
Okay.
Go ahead, Stephen.
Hi, Carrie, you had just said that if somebody was, if they tested positive and then they had quarantined for 10 days and they were still symptomatic, they wouldn't have to test again to get a negative result. I'm just curious, is that because over the 10 days that they wouldn't be carrying enough virus to be contagious? Is that the assumption?
I believe that has been since the start of the virus. That has been the Mass Department of Health guidelines that by day 10 you are not, they don't consider you able to transmit the virus anymore as long as your symptoms are minimal to gone.
Thank you.
So to bring back a question that was asked, about a flow chart. So this information is shared in regard to scenarios in a 12-page document that has been published by the Department of Elementary and Secondary Ed. We're going to share that, and our nurses are going to kind of create a flow chart that's a little bit more simplified, and they will go through that with families as we did this past year. Because when the guidance came out this past year, we've become so used to the terminology that we kind of forget in the look back how challenging it was for everyone to learn, what the ground rules were. Ground rules have changed. And the reason they have changed is because a lot of students and adults are vaccinated, right? And the database, the MIS database, is what for example, if you go on to Mass DPH and look at the number of people that are vaccinated, that information is populated from MIS. There's no name, so there's no divulging of personal information, but that's how we're figuring out percentages of vaccination rates, right? And so this is new. And so we are summarizing in a few slides, and Kerry is describing quickly what is in a 12-page document, which has kind of a protocol A, a protocol B, and a protocol C, which we will get out and we will work through. One of the things that, again, I want to stress, and one of the reasons that we put this on a slide in regard to quarantine and ask Kerry to join us to go through this, is that there are exemptions from quarantine this year, whereas last year there weren't, right? And so one of the things the state is really trying to do is minimize, to the degree that they can, the amount of time that students will need to be out of school. And so, someone is going somewhere here. So I can continue on our slides. So if we can go to our next.
Actually, before we do, so I think we should try to be clear, if we can, around this. If you're vaccinated, you don't have to quarantine if you're not symptomatic. And the fact that we can't require kids to be vaccinated, I don't think we can ask if someone's vaccinated, or can we?
I think we can if it affects their. So if someone is symptomatic, or if they're a close contact, and we're talking about the fact that they might need to go out of school, right, as directed that they might be quarantining, a standard question that we would ask is, are you vaccinated? And the nurses would ask that. There wouldn't be, and so because if you are vaccinated, it changes your status.
Yep.
Right? It changes your status. So that question is not to get personal information as much as it's to really just prescribe the appropriate response.
Yep.
Right? Michael?
I assume if they don't or refuse to answer it, we have to assume they're not vaccinated.
Exactly, Michael.
Yep.
Exactly.
You look at it the other way, though, that so my oldest daughter is vaccinated. If she was a close contact and I got a call, I would say she's vaccinated. If she wasn't vaccinated, I wouldn't say anything. So wouldn't you think that the parents would be more apt to say, my kid is vaccinated, than us having to ask them? They know that their kid can't go to school if they're not vaccinated, so.
Yeah. So I'm not sure I understand your point.
So instead of us asking them, because that's this is not a mandated
so
vaccine.
Kerry would contact the parent.
Right.
Right? So they're not going to. Go ahead, Kerry.
WCAT's got to turn you on. Hold on a second, Kerry.
People might be a little confused about it. It is not a HIPAA violation to request to ask if someone has their vaccine. That is not in violation of HIPAA. So I think that might be where some people get nervous that we might be violating HIPAA by asking that. That is not a violation of HIPAA to ask that.
No, I'm not saying.
I just want to throw that in there.
I'm just saying if people don't feel like it's anybody else's business.
I would just quarantine.
So I think Michael's point would be the default.
Yeah, well, that's what I mean, but well, that's what I'm saying. If I don't want to give you an answer, then I know my kid has to stay home.
Exactly.
But if I want my kid to go back to school, I'm going to say,
I'll
look,
give
my
that.
kid's vaccinated, here's her card.
Yep.
You know what I mean?
Yep. Agreed.
When we say vaccinated, are we saying fully 2 shots, or?
Oh,
are we
yeah.
saying-
Correct.
Okay.
Both.
Yeah.
Okay.
2 weeks after the second shot?
Carrie could probably answer that better than I. If you have a card and you're vaccinated, gives the dates. I think our nurses would adjust from there. If they have any questions, they would coordinate with Mass DPH. There are gray areas, and in the past, when there were gray areas, they would simply call Mass DPH and speak to an epidemiologist and just say, this is a scenario, this is where we're at, this is what we have, and they'd work through it, right? And my sense is that with this kind of differentiation this year in the flow chart of who's vaccinated, who's not, they're going to have to do the same thing again if they're confronted with a situation that they don't know or don't understand. I will tell you that we had one positive case in our Acceleration Academy last week, and we very quickly were able to identify close contacts and kind of quarantine those personnel or those students, and it worked very effectively. In fact, fewer people needed to quarantine because they were masked in a class and at 3 feet, which is the new guidance. So we were in a pretty good place. So those are the types of things that we're going to need to work through. Different than last year, and kind of we'll be working on that and working with the community as well. All right. So testing. We used testing last year. We tested faculty on Sunday mornings. In the spring, we provided PCR testing. This year, the Department of Elementary and Secondary Ed is supporting districts that make application to the department to be invited into their testing program. We have done that. We are going to provide what they call symptomatic testing and what they call test and stay. They're two separate modules. If individuals present symptoms in school, we would simply provide a rapid test. And so that's an antigen test, which is different than the PCR test. There is some kind of, there are some questions around sensitivity of the test. If given a choice, of course, we would go with PCR. But the beauty of the rapid test is it gives feedback immediately or within 15 minutes, okay? So us bringing testing online this year is an additional mitigation strategy that we did not have in place last year. And again, the goal is to keep students in school as much as we possibly can.
Doug, I recently had to get tested. I was exposed to somebody, and the test they did wasn't the antigen. It was like a micromolecular thing of some sort, which was supposed to be a more accurate predictor. It wasn't PCR, though. It was kind of like an in-between that was meant to be more accurate. I had it done at the Urgent Care Center in Stoneham on 28. So there is some sort of a new test. Maybe they were just selling me a bill of goods. I don't know. But they did talk about another one that's more accurate than the antigen, but still isn't the benefit is you still don't have, for the PCR, you might have to wait several days to get it.
The PCR can take some time.
Yeah.
And that's a drawback. The antigen test is more quick.
It's like a molecular one.
Right. I'm not familiar with that testing.
First I heard of it too, just in case it comes up. Yeah.
That might be more for us to learn, right?
Give it a shot. Yeah. Okay.
And so what we do have is support of the Department of Ed, and they would be providing us tests free of charge. They'll be training our staff free of charge because we've been accepted into this program. So we've made application, we've been accepted into the program, and our nurses are going to be training before we start school. And so let me just be clear about this, that no testing will take place without parental permission, right? And so this is all predicated on a parent's willingness to give permission, right? And there's a quick way to do this. We're working with a third-party vendor called CIC. And so this is done pretty quickly, and there'll be more information coming out in the next week about how we are going to seek permission, what does that entitle us to do. And so really there are two ways that we're going to be testing, right? And so if a child is in school and they're presenting symptoms, we would give them a nasal swab and kind of test them. And if they test negative, then we're good to go. They're going back to class. Right, that's if they're symptomatic in school. If they're symptomatic at home, we would ask respectfully that they keep their children are kept at home, kept out of school, and if they have questions, they can simply contact the nurse. The test and stay is for close contact testing, and it's different in that it is also a nasal swab, and samples are collected, but the test is administered daily for the first 5 days. And if you test negative every day, then you continue to go back to class. again, the goal of both of these models is to limit the amount of quarantine or time out of school for children. And so we're pleased to offer this year. It's a new wrinkle for us, but we feel like it's something that is going to pay a dividend for us.
Can we walk through an example of test and stay using the kindergarten, that maybe one that just happened? So if there's like a group of, say, 5 at a table within one tested positive, the 4 are close contacts, are we saying the 4 would have been allowed to stay in school if they tested every day for 5 days?
Correct. Negative for 5 days.
Do we think there's any anxiety around like having kids test every day, like they're gonna get up in the morning? And I know parents have to opt in,
Yeah.
but is today the day I'm gonna get picked? Is the one next to me, like, these are little kids. So I'm glad there's an option. It's an opt-in option.
Yeah. I can see that could be anxiety provoking, and I can appreciate that. I think that's where we're going to need to support students, parents, to make the best call to make it work. If a parent feels like, I'd prefer to just keep my child home or to get a PCR test, I think that we would work through that with our nurses and give the best advice. If we had questions, we would contact Mass DPH. Stephen?
And to sort of piggyback on what Amy was saying, let's say we were talking about some of the younger grades. Are they going to have an opportunity to be sort of introduced to the process by someone in school, like by the school nurse? Is it something that we're going to leave to the parents?
So our school nurses have relationships, very significant relationships, with the majority of the students enrolled in the school. So one of the things that we like about this is that it does have the relational aspect. And so I'm sure nurses, our nurses have, I think, an exceptional bedside manner. I think that they're great with kids, and I think if there was any question on the part of the nurse about a student being apprehensive, that they would absolutely reach out to the parent. Yeah.
Thank you.
You're certainly welcome.
And what question on the symptomatic testing, is that at the teacher's discretion? It's mid-December, everyone's sniffling. Is it up to the teacher to say, you look off today, you should go down to the nurse and get tested? Like who's?
So I think students end up in the nurse's office for any number of reasons, right?
Yeah.
There are students that visit regularly to check in.
Yeah.
There are some students that are directed, and so I think that they could be directed by any number of people. A classroom teacher could do it. I think that what we're really trying to do is just kind of draw a line and kind of with this testing is if you're symptomatic in school, right? If you're symptomatic at home,
Right.
we're going to ask respectfully that parents keep their children home. Yeah.
Again, so like let's say educator, whether it's the school, the classroom teacher, or the specialist, or the principal in the hallway sees the student, I'm assuming they would say, why don't you stop by and just see the nurse quick? I'll send a note down to the class, or whatever it is.
Mm-hmm.
And then I assume the school nurse would sort of make that determination if that symptom was elevated to the level of, maybe we should talk about this, call home, whatever the case would be.
Yeah.
So we're not necessarily putting it on the teachers to say,
No.
you're going into the symptomatic pool.
No, this is not, the teachers are not determining who's being tested.
Right, okay.
Oh, no, I was more saying the list of symptoms is so long, and I've had my daughter sent home for conjunctivitis when it was actually seasonal allergies. So it's like, and it was and you know what I mean? Like there's just such a long list. I get so nervous that kids are going to be being tested just unnecessarily, and I worry for our smaller kids, especially those that are prone to anxiety about school.
Yeah, I think that's where, we completely respect the value judgments of families to say, we're not going to participate. Michael?
Just curious, when we had the hybrid model last year,
Yep.
how did we do this?
This was not an option last year.
You didn't have any testing?
No.
Not an internal?
Not.
You just sent the kids home?
So
and
if
that was up
students
to them?
presented symptoms, they were sent.
Yep.
They were sent.
Okay.
Correct.
Thank you.
Yes.
As far as the parents' permission goes, is that going to be, when you fill out a field trip for the whole year at the beginning of the school year, I allow my kid to go on all the field trips, is it going to be something like that, or is it going to be every time?
No, it's one time, and
Okay.
they can opt out at any time.
Okay.
So they give permission. I think it's done on an electronic form. Permission is given. And if a parent chooses at any time to opt out, then you opt out, right? This is not meant to be a distraction, to be anxiety provoking. This is meant to provide a level of testing that was not in place last year. And again, the goal on the part of the department and districts that are using this model or these models is to really keep students in school, right? To limit the amount of out of time or quarantine for students, right?
Would the parents still be called before a test is given, even if they've filled out the permission slip?
Yes.
Okay.
Yeah.
Doug, on the test and stay, I'm having a difficult time understanding when that gets used, because Carrie went over, if you're unvaccinated and you're not symptomatic, you're quarantined for 10 days. Is that, so how does test and stay fit into that?
So if you're not exempt, if you're not vaccinated, and you're a close contact, which may require you to quarantine, what you can do is you can get a rapid test. We look at the results. If you're negative, you're going back to class.
So this is in place of that 10-day quarantine?
Correct.
Ah, okay.
So instead of being sent out the door, right, so this
You
test
have a
and stay,
chance
you
to
have a
stay
chance.
in.
Yeah, correct.
You test for 5 days in lieu of the 10-day quarantine that it's called for?
Correct.
Okay. And then my second question is related to the permission. Is a no response handled as an opt-out, I'm assuming? So you literally have to opt in order for your kids to be tested?
It's very clear. It will be very clear on the form.
So we're just starting the training for this with CIC Health. But yes, if you do not accept that your child can be tested, it's almost like you're opting out.
Right, okay. That's what I assumed. I just wanted to confirm that.
The nurse will have a list per school of who has opted in.
Yep.
So
it's important for parents to fill that out if they want to be able to get in on this testing.
It's all an opt-in program at the end of the day.
Exactly.
If you don't opt in.
If you're not on that list, you can't be tested.
So could a child then get sent home? The parents could have them tested 5 days in a row, or even the first day, whatever, well, however long it is, and then they could come back? Or it has to be the test that's done in school, the test and stay?
So it's where we administer the test in school, and it's consecutive days, right?
Okay.
So if you're testing with someone else somewhere else, I don't think that that's part of this program, right? So because we don't know who it is, what the test is.
Even with documentation that says PCR test
Correct.
from Project Beacon?
Correct.
Okay.
Correct.
And then when does that clock start? So I'm in class, I'm symptomatic, I go down to the nurse, she tests me, I test positive, I get sent home. Mike's a close contact. Now, when does his test and stay start? Today?
Mike's day, as soon as he's deemed a close contact, he would be tested for 5 consecutive days.
So my clock starts when you determine I'm one of close contact, so which it might be later than your.
Right, but because it makes sense if it's somebody at home and they test at home, it's been a few days, because isn't there something that sometimes you could have well, I guess that's the 5-day testing, right?
That's the 5 days.
That's why.
Right?
Okay.
And that's why it's 5 days.
Okay.
'Cause they say, symptoms start to show themselves
3 to 5 days,
between, 1 and 5 days.
Okay.
So that's why it's the 5 consecutive days.
Okay.
Right? That number's not arbitrary.
So if the parent opts out of test and stay, their child has to stay home for 10 days if they're not vaccinated?
Correct.
Okay.
Correct.
And can I just say, you don't pick which one, you're either opting into testing for both or none.
Okay.
So all of this will be spelled out for parents. They get very clear guidance on this. This is just, we just want, the goal of this evening is to just share that testing is a mitigation strategy that we're adding as a kind of a protective layer that we didn't have in place last year. So,
Last
go ahead.
question. Is this being used commonly in other communities? Just curious.
It is.
Okay.
It is. And so I don't have an exact number.
No, just curious.
And different districts are doing different things. Some districts are going back to pool testing. Some districts are opting out of the whole thing altogether. For us, we thought that this had the biggest, this has the biggest potential to keep students in school. You know, the notion of we talked about pool testing again. We looked at it last spring, looked at it again this spring. And so pool testing by and large, again, is an opt-in, number one. And number two, it really just puts up numbers of kids. So you're testing for not because you're symptomatic or for any reason at all. You're just testing to get negative after negative after negative. And it is all the testing, the pool testing kind of plan is also predicated on high rates or high numbers, rates of participation, right? So colleges, for example, Kevin could probably speak more accurately to this, but college, for example, requires pool testing. So because it's required, the percentages are really high so that they can do diagnostic and they can move diagnostic moves and plans with students that need to quarantine or isolate, right? If, for example, half of a class or a quarter of a class is pool testing, that's not helpful, right? That's not helpful. And it also doesn't help us with close contacts because you're in a pool of 10, right? So then you need to retest to see who in the pool is positive, right? So again, we get into that spiral that we were in last year where we just feel like this gives us the best opportunity to bring testing into the system, into the school system, and also gives us the best chance to minimize the amount of time that students are going to need to be out of school. Yes,
Just,
sir.
when are we expecting the communication for the opt-in would go out?
We just got accepted into this program.
Okay.
And so us getting these onto slides is, you know, the ink was just dried on the application that we just got approved. And so within the next week, we're anticipating.
Okay.
Yeah. So.
One of the questions I had earlier was about at-home test kits.
Yes.
Because those don't get reported to the Board of Health, right, unless you're forthcoming about it? Is that true, or?
That is true.
Okay.
That is true. So, but we would anticipate that if a student is symptomatic and they test positive at home, our working theory is that, of course, that parents would let us know and we would go from there. Yep. So this slide.
You do want that.
That's great. Perfect. And so this slide is just really just a breakout of the two models that we will be using. It's just a kind of a second look at kind of breaking out the text a little bit differently. So next slide. Wakefield Academy Athletics and Band. And so Estelle is with us. Estelle, did you just pop up magically here?
Like Mary Poppins.
You know, do you want to talk a little bit about Wakefield Academy?
Hold on. To turn Estelle on too.
I think we need to turn your mic on.
Estelle.
Hold on for 1 second.
Okay.
Give it a go.
Okay.
You're good.
You can hear me?
Yep. Yes.
Go ahead, Estelle.
Okay. Yes?
Yes.
Okay. I just wanted to say that we're thrilled to be back at the schools. And we will be running our before and after school programs following all Wakefield public school COVID guidelines and policies. And we will be running our after school program at the Galvin, and then our before and after school programs at all of our elementary and our Doyle Early Childhood Center. So we're thrilled to be back, and I can't wait to see our little ones very soon.
Thank you so much, Estelle. And when we post these slides on the website, everything in blue are hyperlinks. So Estelle, we put the registration link right on the slide. So try to make it as accessible as possible. So thank you so much. So the Middlesex League.
Is it at full capacity?
Full capacity.
Okay.
So the Middlesex League, the ML12 athletic directors, Middlesex League, the 12 districts that are in the ML12 will issue direction in regard to mitigation strategies later this week for athletics. So what that is going to include is information that will state that, when sports are occurring indoors and when spectators are also indoors, a change this year from last is that we're not limiting spectators, but we are going to ask that athletes indoors, that they wear masks, right? And Brendan will be putting out more information on this, and there'll be kind of a general letter coming from the ML12 tomorrow, just saying that all the districts are signed on to masking. But there are also some districts will be kind of creating some different kind of protective measures in regard to uses of locker rooms. At this point, we are not doing that here, but that information will come out tomorrow from Brendan Kent and from the ML12 athletic directors. I don't know if there are questions on that before I move to music and band.
Go ahead.
Are spectators asked to wear a mask?
Yes.
Okay.
Outdoors too?
No.
Just
Not outdoors, this is
Okay,
indoors.
just making sure. Okay.
So the
Yep,
same, this is in line with the state mandate.
Thank you.
As far as safety is concerned, I know I've brought this up to you before with indoor sports. Gymnastics, one of them. Is there a way we can amend any part of that?
Yeah, there'll be a breakout by sport. So for example, they're not gonna wear masks in swimming, right? And so
Right.
when you're on the desk, you'll be masked. When you're in the pool, you'll be unmasked,
Okay.
right? And so, if it's unsafe, in certain, for example, gymnastics, you and I talked about,
Yep.
right? It doesn't, if it's not safe for a gymnast to wear a mask in a given event, it might follow the same guidance that swimming does. When you're in your event, you don't. When you're off on the side, you do. Might be that type of scenario.
Okay.
But we'll get there, right? And so right now, our focus is just fall athletics,
Okay.
right? Other questions? Music and band will also follow all COVID safety and mitigation strategies. The MMEA guidance came out before actually the ML12 athletic directors kind of joined in. Tom Bankert, our director of fine and performing arts, is on the board of directors, on the board with MMEA, and actually was a contributing author to the MMEA guidance. So we feel like we're very much in sync with that guidance, and Tom has already purchased, bells for for any horns, and we're going to be distancing when playing inside, and if we're in for a choral practice, we're going to be masked. So we feel like we have band and music, we feel like we have a very good handle on at this point in time.
Will they be able to have their concerts again this year?
We are anticipating that they will, barring any unforeseen spread or any need to kind of change the schedules that we have, right? So one of the things that I just want to be clear about again is that the schedules that we're coming back to are pre-COVID-esque schedules, or pre-COVID-like, right? And so, we're trying to have things feel and be as normal as they can be under the circumstances, right? While being kind of protective about this Delta variant. Transportation, we're fully back with transportation. Students are required by federal law, not state law, but federal statute, to be fully masked while they are on the bus. It also says that, windows need to be opened, and so,
I guess Doug's
It's
done,
back.
aren't you?
Yeah, sorry.
Give him the hook.
Sorry about that.
You're out of time.
It's
Sorry.
okay. So it's a federal mandate that all students are required to wear masks on the bus. And, we will keep windows open to keep an airflow in our buses. There has to be some level of kind of practical common sense applied there. We don't want, it to be 15 degrees and, we have our little guys freezing on the bus, so we're going to work on that. So more to follow there. But the good news is that we're fully back with transportation, which is a plus, and that will include transportation for the high school as well, which is new, or an add this year. And it also is going to include transportation right now for athletics as well. So, yeah.
On the buses for the athletics, will the kids be required to be transported in the bus, or can they go with parents if they?
I don't know yet. I don't know. That's a question.
That's true. You got to wait for them.
Yeah.
Yeah.
That's a.
Just curious.
I know that's a great question. So that's a great question. We can follow up with that, right? So next is just facilities. Sure.
So with facilities, starting first with the cleaning schedule, they're going to be very similar to what you saw last year.
Tim, you might have to turn the mic. I just want to make sure that people can hear you.
Sure.
We like to call it Mr. Baptism by Fire.
You think you can hear me better now?
Yes, thank you so much.
So in regards to the cleaning schedule, we're looking at very much what you saw last year, the only difference being the schedules being a little different, so the actual access to those areas, but we'll be sanitizing and cleaning all hard surfaces. Sanitizing wipes will be available as needed as well. We have access to a contractor for cleaning or moving things and furniture around as needed. We have rolled out the new Purell foam district-wide. This solves a few problems that we had last year with the gel Purell that we were using. It was sticky on the students' hands, as well as it caused some problems with the floor. It would strip the wax right out of it. So we're hoping that it'll mitigate some of those issues that we've had. We will continue to use the electrostatic spraying for high-touch areas. Moving on to HVAC, HEPA air filtration systems will be available in classrooms where appropriate. And over the summer, all HVAC systems have been serviced, filters changed, and some motors and things replaced. So we are in good working order as we approach the end of the summer. Doug mentioned a few of these things in regards to the social distancing and how we'll be setting up desks. We will be available to help with that as needed. And like he said as well, outdoor and alternate spaces will be available for lunch and other activities, weather permitting. And then we also mentioned on this slide, we will not be utilizing volunteers at this time. And additionally, building rentals will be on hold for the time being, and we will be revisiting that in October.
Tim, could I ask you a question?
Sure.
Maybe it's a question for you, Doug. I was thinking about the Galvin auditorium. You know, we're talking about lights, but I assume the kids will perhaps have assemblies in there, and I don't know if we said there's no spacing limitation, so I assume kids will be side by side by side. So that was a question. Is that the intent now, or we have probably not thought about it?
Well, I think we want to try to limit the large gatherings as much as possible, right? I think we want to try to cluster and keep groups in manageable sizes. For example, our plan A to open school is to have our entire faculty and staff, in the Galvin Auditorium. That's 600 people, right? That's our plan A. Our plan B is to kind of do it in a hybrid remote. So teachers, faculty, and staff would report to their buildings and kind of, they could gather in smaller groups and kind of watch on larger screens or be together as a school group, right? And so, like in all of these plans, we have kind of a primary and then like a backup or kind of something that we're working through. And so, I don't know to start the school year if we're going to be getting, 1,000 kids into the auditorium at Galvin. It doesn't seem prudent, right? It doesn't seem like the best practice to start off.
Sure.
But would we like to get to that? Yes.
Sure.
Are we thinking about, full pre-COVID schedules, trips, everything that we've done in the past? Of course. Are we investigating those things? Yes, we are. Are we hopeful that we'll be able to do them? Yes. That's our hope and our goal. But right now, our first primary job is to get everyone into school safely and to get teaching and learning happening and kind of adjust as needed as the Delta variant presents itself.
Second question is more of the building rentals question. So about a week ago, I rented the Galvin Auditorium for a Wakefield Food Pantry concert in October, I believe. Might be November, I can't remember the exact date. So I don't know if the word has gone out about stopping rentals altogether, but we were able to get through. Now, I don't know.
Yeah, you
Just
know,
want to make sure if we're stopping them, we stop them.
yeah. I think we can talk to our director of facilities about that.
Yep. You think he can hear us?
We'll be in touch.
Okay, yeah, you can certainly reach out to me on that if you need to. Thanks.
I have a question. The tent rentals, I know that came up at our last meeting and a couple parents reached out. Have we looked into?
Yeah, so
Oh, okay.
tent rentals were offered. There was one facility that took advantage of that at this time, and we're moving forward with that.
Can we know this facility or is it?
Sure, it was the Walton School.
Oh, the Walton?
Yep.
I know one parent was hoping for a Galvin. Okay. So it's really at the discretion of the building principal?
Correct.
And then they work with you? Okay, thank you.
Amy, go ahead.
You said under air purifiers that if you deem necessary for them to be in a building, what would make that happen?
So in some instances, Doug might be able to speak a little better on this, but there are closed loop HVAC systems where the individual HEPA filters would be redundant and not useful.
Okay.
And so that would be it.
Okay, thanks.
So we've worked with, you know, in any small offices or any small spaces, if kids are participating in small group work and they're in a different size classroom that might not have windows, they have an air purifier in them. And we've also put them into, you know, a number of rooms that do have windows as well, right? So we've really tried to work across all of our buildings to provide as much support and kind of filtration as possible, air filtration. And that's the last slide. Yeah. So I'm glad we asked questions along the way because there was a little bit to.
I have a closing question.
Sure.
As far as communication, last year we would get a weekly COVID report. Is that something we're going to continue this year?
It is.
Can I also request that we track it against last year's data so we could actually monitor trends year over year?
Sure. Tell me your interest in what you'd like to learn about that. Because the reason I asked the question, if I can clarify, I asked the question because the differences here is with vaccinations, I think our positivity rates are going to be different. That's what I'm anticipating.
I would like to see how it is going to differ, if it is, between our positive cases now that we have vaccinations. And I think people are looking for hope. And as leaders, I think we need to give them sort of like we're trending in the right direction. Because right now we're just assuming, and that's why I want to see like last year and maybe track it as a percentage, because when you give like 2 people at Walton is really the same as Dolberry. Do you know what I mean? Like, if we could just, and I'm happy to help. I'm not trying to put any more work on the district, but I'm happy to come in and volunteer a day or two.
We're happy to provide any information that can help people be hopeful.
Yeah.
Right, and help people, you know, understand, you know, how we're doing.
Yeah.
So I think we can certainly provide the data that you're asking for.
Yeah, it would be interesting, and like people say cases go up when we're together at Christmas. Well, how are we going to know that if we don't constantly analyze past and present?
Yeah.
Thank you.
So.
Any other questions? So I've got one. I think we've talked a couple times about, and I guess it probably in subcommittee meetings, about the desire to have, kind of in the same vein as hope, right? Of what are the metrics that we're going to look for to have us revisit this? And so we know that October 1st, through the state has mandated this through October 1st. We know we've got this 80% vaccination rate. Are there going to be other metrics that we would be looking at? And I don't think we need that answer tonight, but I think we need to be thinking about what those answers are. And I think to what Amy just said, as we watch the numbers and we're tracking it, and there's a weekly email coming out, we're kind of aware, but I think if we don't put some stakes in the ground on where we're trying to get to create some to relieve some of the pressure. And I say relieve the pressure, we've talked a little bit about the kids that are old enough that could be vaccinated or are vaccinated. Could we kind of back off 7th and 8th in the high school? At what point would we back off? And what are we calling? And I know it's way too early to even think about that, but I don't want to get lost in the week to week and day to today without having something that gives us and the community some hope. I think we all agree that it would be better if our kids weren't in school with masks, but we need to do that right now. So I would just encourage us to continue to have that on our radar, that we are working to identify what those metrics are.
Can I jump in on that comment?
Sure, Mike.
The priority one is getting the kids back in school in a regular schedule. Make no mistake about that in my mind anyway, is get them back into what is a normal year as best we can. And then we need to figure out how we then talk about the mask going forward. So much like Amy had said, if there's anything we can do to help and facilitate that, to shoulder some of that load, please sing out. I'd be more than happy to help out.
Yeah, our meetings weekly are with the town, and there's a member of Board of Health there. School committee's welcome to attend, and it's a little difficult because it's 9:30 in the morning. It's not a very convenient time, certainly. But leading up to that meeting, if we are getting information out on a Thursday regarding data, where we're at, I would just ask that just let me know if the information that we're providing, if it's helpful, if you want different information, if you want it broken out differently, if we can provide it, we will provide it, certainly. I was talking with Stephen earlier tonight about high school numbers, and what is our true percentage of vaccination? What is our true vaccination rate at the high school? And so with the age ranges broken out the way they are, it's tough to really say with a high degree of certainty that it's actually 77%. Could be higher, could be lower, right? Because in the 12 to or the 16 to 19-year-old age group, we have 18 and 19-year-olds, right? Some of whom are college students who are required to be vaccinated to participate in school, right? And so we need to break it out by year and really disaggregate that information, and we're going to do that in the next week, right, to the degree that we can, and to the degree that we can access the information. But there's more to follow there, Yes.
Along the same lines of communication, you started back up on the Thursday calls that I know a number of parents are able to join. But I've heard that it's a little harder for some people to make the 4 o'clock calls. Is there any way that we can sort of communicate out some of the minutes from, not necessarily aggregate all of the parent questions, but even you definitely have some talking points.
Yes.
And I think that's what parents are curious about.
Yep.
A lot of people are, what did that talk about today?
Yeah.
And so if you had some key points that we could maybe share, these are what we're going to talk about.
Yeah. So a parent suggested that last week is a really nice suggestion. I think we can do that, right? And we can kind of hit the high points on what the questions were, what the answers were. I think we can do that. Absolutely. We can also stagger the time. That the kind of the blessing and the challenge about staggering the time is it might make it accessible to some and not to others, right? What we've gotten some feedback on is we appreciate the predictability of it.
Yeah.
And so that's kind of where we're at there. But yeah, it's good feedback.
Okay.
All right. And so that's it for our presentation in regard to reopening and our mitigation strategies. To get back to our agenda, we've worked with the Policy and Communication Subcommittee to update our face covering policy, which I know at this point is superseded by Commissioner Riley's mandate. But in regard to honoring the work and kind of updating our policy and having that in place, I shared it with you. I shared 2 copies. We shared a red-lined copy, and we also shared a finished copy. I don't know if anyone has any questions. I will be happy to answer whatever question that I can. I would also be happy to include anyone from policy and communications that might be able to answer questions as well. Excuse me?
I have a question in 1 second.
Of course.
Of course I have a question, or of
No,
course
no.
you'll answer it.
Of course, I'll be happy to answer. Yeah.
I would have a question so it seems to me as though the state's statute would supersede this, but we're going to put this up sort of just as an undercurrent. It'll exist there always with the state superseding.
Correct.
October 1st, the state comes down.
Correct.
With the assumption it's going to perhaps fall below the mark, or maybe we couldn't even know that, but if they just took their policy out, their statute goes away, this is now sort of what we're abiding by.
That will be the policy of the Wakefield Public Schools.
Yeah.
Right.
I have a question on this policy document. I don't know if it belongs in a policy document, but I'll throw it out there. So once let's assume that we find certain milestones, whether it's vaccine rates or something else, that says, okay, once we cross this threshold, masks can come off within a particular age band, let's say. Is that something that would necessarily be added into this document, or we would consider that separate from this policy document?
I think we would edit the document.
Okay.
Right? I think that's...
Okay.
Yeah.
See, I don't,
Okay, sounds good. All right, thank you.
I don't know if that was my understanding. I thought we were making a very general document about face coverings, and then outside of that, we could float in and out of it by grade or time limit.
So, so how would we float in and out of it without changing? I feel like you might be talking about the same type of change, right? And so we're talking about changing the document as needed.
Right, like we have a lot of policies that we would go and look to. For example, one we're working on is the logo. We're not always changing logos.
Correct.
So if there's a time where we don't need face coverings, we
Yeah.
just don't use the face covering policy.
Right.
Because if we keep editing every time, okay, we're going back, we're off, we're back, grades this, that, I just feel like we would do that outside this as sort of operating, under the operating, whatever, the opening the schools, however you want to, opening goals or operating goals, or, that's why there was no specific like age in here or grade. There's no time limit.
I think a little differently. I just have a slightly different,
That's
I
okay.
think, perception based on what we talked about. I think in light of, kind of the current situation, I think this is the type of policy that is likely going to change multiple times over time, unlike maybe other policies which are a little bit more standard and probably aren't going to be revisited anytime soon. We had talked about as a subcommittee that we would constantly kind of be revisiting it on a fairly regular basis. We didn't want to prescribe it. We talked about that. Was this going to be a monthly thing we're going to revisit, et cetera? But how this policy works, and it says it in the last line, this policy will remain in place until rescinded. So I think, if at a latter point of the semester, say, for instance, we find ourselves in a slightly different situation, that we as a committee wanted to kind of revisit this policy to change things, to exempt certain students from needing to wear policies, or all students, I think we would just revisit as necessary as we would go through the year.
But then we would have to wait for the policy subcommittee to amend it, then we'd have to wait maybe a week or two for then the school committee to adopt it. And what if we wanted to do it quicker than that?
I think we're always empowered. Someone can correct me if I'm wrong. Theoretically, that's our internal process that we follow. But if at any given time a committee, we wanted to present a change at a regular meeting, we could.
I guess somewhere, I just want to document it. If we decide as a group that when an age bracket reaches 90% vaccination, we will consider or take the masks off, whatever the case. I'd like to have it somewhere, so at least you understand, recognizing that circumstances could change. It may not just be vaccination rate, could be something else that are involved, but that, and then we have to adjust at that point in time. If something else happened untoward that we just didn't even anticipate, that even though we're at 90%, there's some other issue going on. I get that, but I would like to have a target somewhere documented that we're going to at least try to adhere to, if at all possible, from a mask perspective. Whether it's in this policy document or somewhere else, I guess I really don't care.
Sure.
So I think there's a bit of a follow-up to Mike and Amy's questions, and it's either going to be helpful or not, I don't know, but Mike used the word a target. Excuse me. I would like to use the word trigger. That what sort of trigger or threshold may invoke this policy in place, or may invoke us to be thoughtful to take it out of place. And I did read, and I appreciate, Kevin saying that it remains in place. I did see the last sentence when I read it until it's rescinded. So sort of a follow-up rattling on question is, if we vote this tonight, then it becomes in place now, regardless of any parameters or anything else happening in the world around us.
Correct.
And then as what and maybe I'm looking for the threshold or the trigger to what would invoke us to, or the administration perhaps, to say, let's revisit this. I have no problem with it being changed as a policy. It could be something that's a standing, and I think it probably is now it's extemporaneous thought, but maybe this is a monthly agenda item that we're always, for this year anyways, we're always looking at this policy. What is moving, what is changing, what is not. I mean, certainly we're going to be talking about the topic, and I think we can't, with this as a policy in place, we're going to be, the district's going to be required to follow it until instructed not to.
I think COVID updates are going to be a standard part of every school committee meeting, like they were last year. And so, if we're reporting thoughtfully, we've talked a little bit tonight about, what is good data, what we'd like to see. We want to keep people engaged. I really appreciate the comment about we want people to be hopeful and let people know that we are kind of open to keeping track of. I don't think that there's any way that we can't be in this position and not keep track of, right? And so, because I do think it's going to be a fundamental part of our work, of our weekly reporting. Our COVID meetings on Friday are back in play, right? Our meetings with Board of Health are back in play. Looking at COVID numbers are back in play. Quarantine back in play. Supporting students and families, as they need to quarantine. Those are all parts of upcoming reporting. And so I think they're going to be part of every school committee meeting, not monthly. I think it's going to happen twice a month. And it's going to happen every week on Friday. So hypothetical, if we get into October, or if we get into the third week in September, fourth week in September, and miraculously, COVID our numbers look to be much better than anticipated in regard to the spread of the Delta variant in Massachusetts and in Wakefield. And if that's the case, we're going in that direction, we would report, or we would make a recommendation. Even if it were in between meetings, we could kind of reconvene. Even if we did it via Zoom, we could reconvene the policy and communication subcommittee group to say, can we review this data? This is what's changing. We feel we want to kind of be in step with this. Our recommendation is to kind of, and then I think we can do that pretty quickly. So this is, in my estimation, this is not different than, this group gave us the authority last year to, and we would do it in consultation with you. We kept you in the loop, but if we needed to close a classroom, if we needed, we consulted with Mass DPH, or we consulted with DESE, and we let them know we're closing a school, and they would say, okay, we trust you based on the data that's provided. If that happens again, I don't think we're going to be reconvening as necessarily a subcommittee. My working theory is that you would again give us the authority to make that call. Of course, we would keep you informed, and we would go from there. But this, I think it's the same type of dynamic with masking, right? And so, and with data. So this is, I think, an important kind of piece to articulate in regard to what to expect, right? Because I think everyone wants to know, everyone watching, everyone on the committee wants to know, so what can we expect? And so I think what you can expect from us is weekly reporting and reporting in every school committee meeting, right? Around how we're doing with data, and so how we're doing with COVID, how it's managing, how, where are we with the mask mandate? How is it working? How is in person, how is it in school? How does it affect outside of school? For example, PE and wellness classes outside. What does that look like? What does athletics look like? We have to get into our schedules to kind of get this information, which I think was Michael's point earlier in regard to, Susie, when you were talking about what is the trigger or what is the metric. Michael's point was, I think we need to get into our schedule. I don't want to misquote you, Michael, but I think that's what we need to do.
So from this conversation, I would argue that we know we want to identify the triggers, right? And I think the question is, do they belong in the policy or not? I would leave that with the policy subcommittee to decide whether that is a place where we would put them or not. Kevin, I thought you were saying it was where we would put them, but you're shaking your head, so I think that that's a no. Okay, so
Just my personal opinion.
Yep,
Yeah.
but and I think you guys can take that up as a subcommittee as to at what time would we modify the face covering policy. But to get there, I think we need some of those triggers, right? And I think we need to leave that to Doug and team to kind of come up with those. Go ahead, Stephen, and then I'll come back to you, Tom.
I would just say if the policy comms committee remembers, when we initially talked about this document, we said that we were going to look at it every time we met.
Yep.
We didn't. So to your point, like we said literally in the meeting, we will talk about this every time we get together and see if we need to look at something again.
Perfect.
And then talk to the greater committee, but it was never going to be off the table. Like we were always going to look at it in regards to the data. And then I get a little bit lost in when we're going to draw the line in the sand. Like I'm pretty sure I'm not an epidemiologist, so I don't necessarily know where that line in the sand is. I'm looking at what do the professionals say? What do the 70,000 pediatricians that are part of the AAP say in terms of when is it safe for our kids to to be back in large groups without face coverings? So I get a little bit lost in, I don't know when we would come up with that number, and then when would we change it, and when would I would just think that we would always look to the science and look to the professionals. So I'm confused about that point.
Yeah, I guess one of the things I was going to add is I really get the desire, I think, for people to want an if this, then that, and to really want there to be a really easy answer. We hit 90%, it's that. But if there's anything, at least I personally have pulled from this time, is we're still learning what this is all about. At one point, we thought if we were vaccinated, we're in the clear. The speaker was right. I was at our retreat, no mask, like living it up. But we now know, even since then, wasn't that long ago, we know that much more about the Delta variant. And we now know, even though I'm vaccinated, I can now give it to somebody else. At one point, they didn't think that was possible. So I only bring up that example is because this is constantly evolving and our understanding is evolving. I don't want to have some kind of arbitrary figure in here that's based on one criteria when it's much more complex than that. It's what does the health department say? What do the pediatricians say? What does the CDC say? What is our current understanding of what's even going on with other future variants that may be coming? Because I agree, this may end up being something we have to live with, but maybe our understanding of it becomes more deep. So I'm hesitant to put something in there, but acknowledging, man, I think someone used an off-ramp, like we all want to know what that off-ramp is. I do too. but I'm just hesitant to put it in there. I think we continue to monitor it, and we use the experts, the data, and where we are as a larger community if and when we make any changes. And I desperately want to make those changes as soon as it's prudent to do so.
Right, so in theory, we could vote it, say we get to unmask the high school, we could just vote to rescind this policy for the Wakefield Public High School.
Yeah, we could amend
And just,
it.
but why would we amend the whole policy? Couldn't we rescind it for just one group or no? I just want to keep rewriting policy just to keep adding and putting in and taking out groups. So would we be allowed to rescind a policy for one specific group? I don't know the answer to that question.
Mr. Markham is nodding yes.
Okay.
I'm saying, I would agree, we could.
So we could just leave it the way it is and then work in and out of it.
I think we might be, I think that we're overthinking this.
Oh,
I think,
yeah, but that's just
and so,
my nature. That's why we're
I'm
sitting
not
here.
saying you are overthinking this. I think collectively, I think we all want the same thing.
Right.
Right? And I think that what's important is that there's a commitment to stay on track, to stay kind of attentive to what we're learning and what the data and what the science tells us. And so I think we all want the same thing, to get to a space where we can get kind of back to a more normal schedule. You know, like the direction we were heading in June. That's a space that's our goal. That's where we all want to get to. And so I think we can amend that policy, or when you say rescinded to a grade, and you know, and I say amended for example, the high school, right? We're talking the same thing. Outcome's the same, right? But I think we're getting stuck on process. I think we can amend. When I say amend, you say rescind, it's the same. I believe it's the same. It gets us to the same space.
Mr. Markham.
Thank you. So I asked the question, and I appreciate how the dialogue that ensued. I wholeheartedly agree with Dr. Piscatello's comments with regard to now understanding and appreciating, you know, why this as a policy came about, and the caution that I think we should have about making it too specific and making it too day-to-day. We are in a very changing environment as we are learning every day, and I think to enact something that's going to have some force that is also going to require some level of you know, administration to execute, the more limitations that we put in the policy, that is, the more difficult it's going to be for everyone from the superintendent to every staff member to administer. So I appreciate that dynamic. When I asked for examples or ideas around the word, you know, trigger, what would trigger changes? What would trigger everything that I heard from the superintendent, from Dr. Piscatello, and from others, frankly, was what I was hoping to hear. You know, and because we seem to be, and correct me if I'm wrong, we seem to be winding down and summarizing lots of research and work that's gone into the school reopening plan, commentary that we've heard, and we're about to vote at some point soon on this, right? We seem to be summarizing and landing in that square. So I very much wanted to hear what some of those triggers were that would allow us to sort of, you know, we use the word opt in and out. We use that numerous times tonight, right? So we're about to take a vote to opt into this policy. What I'm hearing now is a variety of information that will be shared weekly, if not more frequently, with the community, with ourselves, with the community at large, that would allow us to opt out and or modify this policy, frankly, at any time. Amy, one of the things that you were, and I think you were hung up a little bit on process, we do have the authority to set aside the policy amending process in terms of exigent circumstances or emergency, which we have very seldom done, because policy should be thoughtful it should be agonizing to land in a place, but we do have the ability to put something aside. So if we needed to act more quickly, that authority does exist. So I think the answers that I sought regarding, triggers, I wasn't suggesting triggers be set in the document, but I wanted to hear and have the community, frankly, hear what some of those triggers might be and how frequently we're going to be attentive to them, because we're being asked to create quite an imposition on the community. I have no authority to say, go ahead, Amy.
You're good.
Sorry.
We never,
Yes,
we
Amy.
never, we never came out of the face covering policy, correct? So tonight we're voting to update the policy.
Correct.
And the state already told us we had to mask.
Correct.
Okay. I just want to be, we never came out of face coverings. So we're not voting, right, for face coverings because we've never left.
True.
Okay.
Well, we're now creating a policy, whereas previously it was really a 1 year.
There was never, I don't think there was a date in the previous policy.
Technically, I guess we didn't rescind it, so
We never left.
Which is why it's not a new policy, or we're amending what existed, right? And so, that's where we're at, and so.
So we're voting on the amendments.
Correct.
Okay.
So I don't want to belabor the subject a little bit, but I just want to jump off what Stephen said as far as, trusting the experts. Mike Boudreau isn't a person to determine any metric that we're going to use for a trigger. The first to back off. But that doesn't mean we don't look for measures at the end of the day. So if the American Association of Pediatricians say, we think it should be when this happens and when this happens, I'm fine with that. My concern is if we just leave it up to something more subjective or broad, then it's left up to the interpretation of a variety of groups and you never know when it's truly got a chance of ending. Versus and Don talked about it before, we need to try to find some specific triggers, and I understand these may change because of other things going on, but just saying we're going to wait until the Board of Health decides that we're going to wait for this, I get that, but there's going to be some triggers that they want to use to make that determination to go from masking to not too. So there's got to be something concrete underneath that versus I just feel like it's a good time now. So I clearly want the experts to make that determination, no doubt. But we do need to have something measurable and targetable, that kind of thing too, as part of this. That's just my 2 cents.
Amy, did you had your hand up? Go ahead, Amy.
I have a couple of things. So on Commissioner Riley's update from today, it says the mandate will apply to students age 5 and up. And then if you go to the WHO, they say that children age 5 and under should not be required to wear masks. So I'm just wondering if we have 2 examples there, one is a major health organization in the world, and the other one is the commissioner who we're apparently listening to right now, and his board. So can we put something in here that says children age 5 and under are not required to wear a mask?
So we are proposing that this mask policy cover pre-K through grade 12 and post. And so that's what the CDC and the American Academy of Pediatrics is advising. And so that's why we're making the recommendation that we're making. Not all districts have a pre-K, right? Which is why I believe that Commissioner Riley said K. And so that's my understanding. And so so that's why we're making the recommendation that we're making. Could the committee suggest that? I don't think that that's what policy and communication as a subcommittee are recommending. And so so that's kind of where we are right now. I think members of policy and communication could certainly join in as well. But so we need a plan to open school. Right? We need a plan to open school. We have a mask mandate from the state. The way that our policy is written, because the because the state has used statutory regulation to create a mask mandate, and not all districts have a pre-K. Districts need to choose what they're going to do with pre-K, right? If we don't mask pre-K, I think that that's going to create an issue, and I think some people are going to be concerned in regard to safety.
It's not necessary, and I think this is where a lot of people get kind of thrown off. It's not necessarily unmasking these kids. It's giving families the option if they want to do it. So I think there's a middle ground that a lot of people are missing out on. There's people that do not want to mask their children or themselves or get vaccinated. That's their business. There's other people that want everybody to be masked and vaccinated. That's their business. There are people in the middle who, can go either way. If they feel it's safe to put a mask on, they put a mask on. If they feel it's they don't want to take it off, they take it off. So it's just, I'm reading two kindergartners are 5 years old. So both Commissioner Riley and the WHO are saying 5 and under. So we have kindergartners. Every town in the Commonwealth has kindergartners.
Correct.
So to me, that's saying kindergartners. Obviously, there's some 6-year-olds, but 5 and under. So if they're saying should not be required to wear masks, it's just a hard time hearing those words. It's not saying, don't need to, or, if they don't want to. It's saying should not. Those are strong words. And that.
So I haven't seen the WHO.
Okay.
You're referring to the World Health Organization.
Yep, I have it pulled up right
I
here.
haven't seen their guidance.
Okay.
The guidance that we're looking at is the American Academy of Pediatrics as well as the CDC, and we're referencing that for the policy that we created. So to change, we need to open school, right? So if the committee is, I think I'm seeking a vote from the committee on the policy that's presented. If the committee wants to wait on that, I think that.
I don't think we can wait on it.
I don't know that we could open school, to be honest, and I think that would ripple, right? I think that to split the policy and to split kind of pre-K away from the rest of the school district, I think would impact families who are enrolled. I think it would impact teachers that are planning on coming to work. And so this is a safety and mitigation strategy that I think people are feeling like this is something that is worthwhile to keep people safe. So I understand both sides of this, and I hear both sides of this, but I think that when we write policy, we don't write it for either extreme. We write policy to try to create a safe space for all parties, right? And so that's kind of where we're at. And so I think I would ask respectfully that the committee vote on the policy that was presented. If you wanted to change the policy, you could give me that feedback or give us that feedback. I shouldn't say me, because there is a subcommittee for this, and this is a school committee policy. It's not a superintendent policy. This is a school committee policy. So you all have to feel good about the vote. And the policy that we're putting forth to open school. But I would agree with Susie. I don't think we have the ability to wait or kick the can down the road.
I don't think we would have to. I mean, technically, I think I could make a motion to amend this now, and we could take a vote on the amendment. If it doesn't pass, it doesn't pass. But
Can I just interject just to support Doug's point, just in terms of thinking about preschool in the public school setting. The very nature of us having a public preschool through Wakefield Public Schools is really based in our students with disabilities within the community. That's the reason we have a public preschool as a starting point. We then offer it out to our community to tuition and peers who can serve as role model, as social models, academic models, to create an integrated model. So I just don't want to lose sight of that. Our students with disabilities also can be immunocompromised, can have medical challenges as well. So I just want to bring back that focus of the Doyle Early Childhood Center within our public school program and why we have the preschool here. It's just a little different than a private preschool running in town. So I just don't want to lose sight of that. If we don't mandate masks for all of our students at our preschool, we will have some students who are unable to access the program. So I just want to bring that up for you to think about when separating. I hear what you're saying about the 5 and under and the challenges. We also have students with behavioral and medical behavioral needs who are challenged themselves to wear masks, so it supports to have the peers around them wearing. So I just want to bring that up because I think it's very important to the overall functioning of the DOIL.
Can I ask a quick question? If since we've never left this face covering policy, and we're only voting on the amendment, would we have to then go back to the union and do another MOU?
Around face coverings?
Yeah.
That's a good question. I mean, I think we're looking at our MOUs in general. I'll defer to you, Doug, if you have more thoughts on that. I know we're meeting with the
Our
board
labor
tomorrow.
subcommittee, we have other subcommittees too. Our labor subcommittee has not met with the WAA yet to talk about updating our MOUs. We're meeting with the WAA tomorrow to kind of go through some of this, but I'm quite sure that it would be an added agenda item straight away, because I think that their belief is that the policy that we would be following is a pre-K through 12, pre-K through 12 and post. So there are exemptions as well, right? And so,
Just a point of clarification, make sure I have this right. So, and I was just, so DESE is saying 5 and above.
correct.
So the real issue is, well, if we're going to stay consistent with DESE, which I guess we have to, at least for the time being, is under 5. So it's all under 5. So it's all pre-K, obviously, because of that, in that regard, that we'd be dealing with. And the pre-K is I'm just curious, is it just is it just 4-year-olds, or we have 3-year-olds?
We have 3 as
3
well.
and 4,
Yeah.
okay.
Students are
Well, 5 wouldn't matter.
5 wouldn't matter,
Right,
right,
but 3 and 4 are really would
Right,
be impacted by it. Okay, okay, thank you.
And I totally get what you're saying, 100%. My child goes to the Doyle, and chances are I'd probably put her in a mask anyway. We live with my father, who has health problems, and that's not something that we want to deal with. This is where I have such a hard time with it, because I totally get that side of it. And that's what I'm talking about, the people that are in the middle, not the extremes on both ends, is that it's just so hard to be told that this is what, DESE, this is what the school committee, this is what we're being told to do. And I just have such a hard time being the person that's telling somebody else what's best for their child, when I don't want somebody telling me what's best for mine. So it's not to say like I'm totally against masks, I want my kid to school with a mask. That's not even close to the truth, you know what I mean? So I just have such a hard time. And even with voting on, I guess now, this amended motion, I don't even know how I vote, because if I'm not agreeing with, it's hard. I'm not saying I don't agree with masks. I'm saying I want people to be able to have their own choice. So does that mean I vote no on this? But if I vote no, is that putting the old face coverings back in place? Does that make sense? I don't.
Yeah, our old policy is pre-K through 12, right? And so our new policy is pre-K through 12 and post. I mean, so they're the same.
Yeah.
I think what's added, you can see the red lined, compared to, and so what's not changed is the age ranges, right?
Right.
And so if we use the default that is outside of the footprint of what's mandated, our policy would be that pre-K would mask, as I understand it, right? And so again, I don't want to speak for the Policy Communication Subcommittee, just myself, but that's as I see it, right? So please,
And I had another question too, and I didn't have a chance to watch the video from this morning yet from DESE, but did I read that he said religious exemptions would not be allowed?
I didn't. I saw the vote. I did
Okay.
not see. There was an email that I shared with you earlier that his guidance has taken religious exemptions. They feel the greater good, and for the health and safety of students, that religious exemptions would not be honored.
So how can, and then when I'm reading on here that, let me just make sure this is added.
We have them in.
So we added, all right, so with policy, there's a set guideline from the state. Here's what Riley is telling us to do.
Correct.
We can do more than that. For example, require children under 5 to wear a mask. We
Correct.
can't do less than that.
So, but
So-
what we can't do is provide an exemption that he's saying is not in the greater good or is not in line with. We received a legal brief today from MASS, from the Mass Association of School Superintendents. That was an 8-page brief on specifically on this, right? On, it's on a number of things, but part of it was on this. I also spoke with the executive director, Tom Scott, who shared that the feeling is from the department and from their legal team is that religious exemptions at this point in time are not going to be honored because they feel like it's not about a medical condition, and this is about the greater good. And so I'm just passing on. And so because of that, their advice to school districts, their legal advice to school districts, is to not entertain, not honor religious exemptions at this point in time.
It's not even advice, it's mandated, really. So,
I don't understand how they could say that they're not going to honor somebody's religious beliefs.
So I think there's case law, and I do believe that there's a Supreme Court law as well that states in the brief, it's kind of lists all of them.
Yeah.
Right. I'd be happy to provide that for you. But what they say is that when it comes to public health, when it's in the greater good to keep people safe, healthy, and well, that religious exemptions sometimes are not taken into consideration. So please, this is a sensitive subject for me.
Yeah.
And so, and you'll see that we've added and we've worked with policy and communication to add that as an exemption this year.
That's what I want to make
So
sure
to
that-
work to add it and then to learn that, based on the new guidance, that, it should not be honored based on the state mandate, that's a tough, it's a tough change.
Right.
But, there are kind of, that's why we have legal counsel.
Right.
Right?
Well, that's what I was
that guides, the school committee, and that guides the superintendents. And so that's kind of where we're at.
Can I suggest, sorry, Amy, is that we can always approve this and then put an amendment in 2 weeks. Maybe we need more information.
So
Yeah,
I think,
don't know what you guys think.
I think an amendment in regard to the legal exemption, I think that's, I don't know that's,
Kind of change.
I don't think that's going to change from the state, right? I think their position is pretty rock solid on this, right? And so, yeah, I know, I can understand how this can leave a taste. I had a kind of a spirited phone conversation today to say, this is a change, right? And so we went in this direction, we expanded it, and now we're being told we can't use it. You're correct.
So I assume at this stage, all we can do is see if on October 1st that changes. Because they're probably not going to make the hope is that the state buckles on this issue and allows a religion. And they're not going to, they haven't done that now. So we don't really have much options. The hope is by October 1st, if there's enough community pushback, perhaps they'll put it back in. I don't know what else we do, honestly.
I don't know, Michael. That's a great question. I think Jeff Riley's really focused on 2 things.
Yeah.
And I think the Board of Education is focused on 2 things. Getting students back into school and keeping them in school, right, as much as possible, okay, number one. And I think that they're most interested in getting as many people vaccinated as they possibly can.
Yep.
Those are the 2 things that come up over and over and over. And, we too feel like those are key things for us to focus on at this point in time.
So if somebody comes to the school with a religious belief that they cannot wear a mask,
Correct.
how are we going to handle that?
That would be, we cannot honor that request.
So they have to wear a mask?
Correct. So they can get they can get a medical exemption. They can get a medical exemption if they can. They can get so the exemptions that are in place, Amy, are for medical or behavioral, and so that's where we're at.
Yep.
Okay, well, that just sealed the deal.
Okay. Okay. We ready to make a motion?
Sure. move the school committee approve updated policy EBCFA, face coverings, as presented.
Second.
Motion made and seconded. Discussion?
We get to talk about it more?
I have to say that.
We talked about it for a whole weekend.
Okay, seeing none. All in favor? All opposed? Okay, so we've got 6-1. Okay. On my agenda page. Calendar. Kara.
Sure, I can jump in on that. So within your packet, we have an updated calendar. I know that the school calendar was approved back in the spring. We felt in working with our administration across all levels that we needed to add a little bit more detail for families, just for some key dates. So I'll just highlight some of the changes. So we thought it was important to get our back to school nights at every level on the calendar. So you'll see those staggered throughout September. We are still talking about whether or not those should be in person or virtual. So more to come on that. We're weighing the pros and cons. And then I will also highlight, if you look ahead to before March, November, we felt it was important to get parent-teacher conferences on there as well. And that entails a half day for pre-K to 8 on November 3rd. We thought that was important for family planning to get that in there as well.
In person?
We are talking about offering parents an option, maybe. We're still in the works. Virtual conferences worked out really well last year, I think, on both sides for staff and parents. So more to come. We haven't really flushed it out, but I think, of course, if a parent feels like they need to meet in person, we aren't as restricted as we were last year, but I think the virtual conferences were very convenient for a lot, so more to come on that. But we are still accounting for a half day and then time at night as well for families to sign up. And then the other big change is just to jump ahead to March, and it's the same thing, an early release on March 30th, pre-K to 8 conferences built in there as well. And I think everything else on here was reviewed by all of you in the spring. And then I think the only other change, we're working on making some calendars that have the 6-day cycle rotation per day, which I know people rely on. Elementary will still be on a 5-day, but middle and high will be on the 6-day cycle through the school year as well.
Kara, when it's the early release days, when it says pre-K to 8, that's only, so high school and Doyle would, pre-K, so
Yep,
high school
pre-K
would
is
not have a
included.
half day.
High school has a separate 2 nights that are at night. I
Okay,
believe,
so
for the
they
most
would have
part.
a full day of school, okay.
Correct. And that's the same in March as well.
Okay.
Any other questions?
Okay, go ahead, Tom.
Pretty standard. That's a light topic tonight.
If a motion's in order, I'd make a motion that we approve these 21-22 school calendar as revised and presented.
Second.
Motion made and seconded. Discussion? Seeing none. All in favor? All opposed? None? All right, that passes. Danielle Collins, are you still on with us?
Poor Danielle.
Oh, there you are. We have echoes. Hold on.
Wasn't that exciting for you, Danielle?
We're so excited.
There we go. And we can hear you.
Can you hear me okay yet? Or
We
no?
can.
We're good. Okay. Just a quick update as far as school nutrition goes. First and foremost, meals are free this year. All meals in schools will be free. So once again, all meals are free. Please don't hesitate if you have any questions to reach out to me. There is no application required to participate in our programs. Your child probably will check in with the principal or the teacher just to say they're eating on that day so we can prepare enough food, but there is no requirement. But one point of clarity for this year, which is kind of strange, and I just want to put it out there. If families are looking to access other benefits, such as PEBT, athletics, Wakefield Academy, Any of those other programs, we're still going to be utilizing the free and reduced form. So I would highly encourage parents to, if they are looking to access those benefits, to fill out a free and reduced form as well as a share form with who you'd like for us to share that information with, so that we can get you access to those benefits. So that was the first point I just wanted to share with everyone. Procurement this year will be a challenge. I don't know if how impacted you are in your personal lives if you've been out to the food stores or whatnot, but our costs have increased at least 8%. Shipping costs have increased. Paper costs have increased. They call that the Amazon effect, actually. So because so much cardboard is being used for Amazon, it's actually impacting our paper costs. Shipping costs have increased. We have workforce shortages. And what this ends up being is that we won't necessarily get all the items that we've bid for this year. I have opened up other avenues to gather those materials that we'll need to operate. But I ask folks to bear with me. We may have to make changes on the menu if things don't show up as ordered. And it's been a challenge over the past year, but we're predicting a challenge for this year as well. So please do reach out to me if you have any questions or concerns. We did a pizza bid, a hot pizza bid, and thank you to Estelle, who provided for us some taste testers who were absolutely lovely. We did that during summer school. It was absolutely a delightful experience. Our experts have awarded the pizza bid to Lisa's Pizza, so that's something to look for, that our kids can look forward to for this year. Once again, thank you to Estelle for providing the kids. And our meal distribution has ended. We actually finalized our meal distribution on August 18th. I wasn't able to complete the chart for participation, but just to give you, I ran some numbers. I don't have the complete graphic that I typically share with you. I will provide that. Just to give you an estimate, or in comparison to last year, because I heard a lot of the discussion, like where are we in comparison to last year? Last year in August, we served 3,178 meals, and this year we served 3,920. So slightly busier than last year. We did have steady participation with our families. In August, we served a total of 280 students, in case any of you were interested in those data points. Did anyone have any specific questions?
Looks like we're good.
Oh, wait.
Sorry, Amy.
A lot of parents are asking about hot meals at the elementary school. Do we know?
Yes. So I fully intend, the plan of action was to try to go back to things 2 years ago as much as possible. Will we have all the hot items? Probably not. Some of the things where, we're going to be trying to respect just simplifying lunch for our students so that they can, eat in a clean and orderly fashion. We'll probably stay away from some items that might be a bit messier, like spaghetti with meatballs, as an example. But yes, we will have hot food. We will have hot pizza. We will integrate things as much as possible, looking more like a model from 2 years prior than this past year. We will not be serving exclusively cold items. But once again, procurement is somewhat of an issue, and we are trying to simplify the menu. So it won't be exactly 2 years prior, but it's going to be some sort of a middle of the road.
Thank you.
Go ahead, Stephen.
Is it high school, middle school, and the Woodville that are doing breakfast this year?
Correct. The schools that provided breakfast prior to the pandemic will be providing breakfast this year.
That's free as well.
Free in school.
Any other questions?
And just to offer a point of clarity in case parents are, we're getting the ball rolling for the coming year. And this past week I ran direct certification, which means that for many families, the qualification in typical years for free or reduced meal program would be an automatic qualification because the family somehow qualifies for some other aid at the state level. I did run that direct certification list. Those families will be receiving a letter from me along with a share form in case they would like for us to share that information with those other outside programs. The PEBT would be automatic, but the other, Wakefield Academy or transportation or athletics, that would be something that folks would need to just provide a share form for us to share that information.
Okay, Mike?
Just a comment. So we've been, the food pantry has been talking with Danielle for months at this stage, and we finally gave her a tour of the facility this last Friday, I think. And Danielle has generously agreed to assist us with our strategic planning process. She's amazing. The amount of work she goes into this to make sure the kids have balanced meals is off the charts. So I just wanted to recognize you. Thanks for all you do.
And you've been amazing also. I mean, honestly, this is just a relationship.
I was hoping you'd
made
say
in
that.
heaven. We help one another. We're helping all the same family. So all together in the team, whatever I can do to help, I'm happy to.
Appreciate it. Thank you.
So, Danielle, just back to the free and reduced, do you have an idea of a delta between how many people have signed up this year? Because I know that there aren't as many people because they hear that lunches are free. So they are going to have trouble accessing those other programs. Do we know what the delta is between previous years and this year? What?
So it's a little difficult to track because once again, a lot of folks are directly certified. So there is no requirement for them. They don't actually have to fill out the application. I mailed out just under 200 letters for those that would qualify. It is higher than in years past. There are more folks that are directly certified than in years past, not substantially. I won't know until I'm completed with the process. So free and reduced applications can actually be received by parents throughout the year. There's never a timeline. In typical years, whatever the qualification was from the prior year, it would expire sometime in October. So each and every year I would reach out to those families and say, hey, you have been receiving a benefit. If you'd like to continue to receive that benefit, please make sure that you reapply for this academic year. This year, I've been going to trainings with the state for months now. One of the strange things about this year is whatever the family's qualification for last year, it won't be taken out of the system, ever. It will not expire. So if a family happened to be free last year, they'll remain free. If they were reduced last year and they qualified via direct certification and or an income application, and now they would be free for their qualification, that would supersede the reduced qualification, but they won't lose the benefit. So it's very difficult for me to actually respond to that question at this time because there's kind of this trickle effect that is not normally in place, but I am tracking the data very closely. I feel like I can give you more substantial information once we get to October and November. So I'd be happy to report back as to what sorts of changes I see.
Thank you. It does seem like it's been an aggressive sort of communication strategy, you getting it out there. I've seen a couple of emails come through from your department. So thank you, and thank you for being proactive with the directly certified families. That's helpful.
And Stephen, can I just chime in? You've hit a trigger point for Danielle, because if it was up to Danielle, she'd feed the world.
Oh, sure.
So
Yeah.
this is a passion project for her,
Very
and
true.
making sure that everyone gets the services that they require,
Yeah.
regardless of free this year or not. So thank you, Danielle, for everything that you've been doing.
And honestly, if I can be of service to families, please don't hesitate to reach out. I'm happy to help however I'm able to.
Thank you.
Thanks, Danielle, for sticking with us.
Thank you.
Yes.
You didn't quite fall asleep. Thank you for inviting me.
Okay. On to subcommittee reports. So I'm up first with Finance and Facilities. We met on the 19th and ended up talking about a lot of the things that we talked about tonight. Christine did give us a quick update on kind of working on some grant proposal work, end of year reporting that's necessary for DESE. Tim gave us an update on facilities and a lot of kind of what he talked about tonight, getting ready to go, hand sanitizers across all the schools, they're well stocked with masks. We talked a little bit about We actually talked about food services and the fact that meal distribution had ended. And then we talked a bit about testing and quarantining and just any impact that that might have on budget. Again, all things that we talked about tonight. So that was our last meeting, and we are not scheduled to meet for a few weeks because we want to get through kind of the beginning of school, and then we will reconvene. Tom, Labor and Personnel.
Thank you. We actually met this morning, pretty much for some updates around a couple topics. One, we spent some time talking about the policy that we discussed tonight for masks, and how that may be impactful for employees, staff, and things that may or may not be need to be collectively bargained and or minimally discussed in the future. So we'll keep everyone abreast of that as that comes about. We talked about the superintendent gave a report on the use of grant funding and the hiring of positions, and what is most applicable for some of the 1- and 2-year positions, and the use of short-term grant funds for that. I talked about the possibility of having remote classes as options, depending on how the fall sort of rolls itself out. But so we'll stay on top of that. And we really sort of had some philosophical conversation, really around what we discussed tonight, as far as what some of our priorities may be with regard to this, being what is paramount, getting, as the superintendent said a number of times, getting students back to school, getting students as close to a in-school normal environment as possible. While the remote learning environment and the Zoom environment had played its role, there is nothing like an in-person classroom. Masks are not, and it's not ideal. Masks aren't ideal, but they at this point are most appropriate. So we talked about that as how to share with the faculty and staff and the community, those being the significant priorities, getting students back to in-person learning, and increasing the opportunities for vaccination. I'm sure at some point, maybe in closing marks, it was on one of the prior slides, but there are some vaccination clinics coming available for staff and students, and we heard a report on that. So we certainly encourage any member of the faculty, staff, or student body who has not received a vaccination to take full advantage of those 2 upcoming opportunities.
Thanks. Mike, Student Services?
Sure. So we met last Wednesday. We talked about a bunch of subjects. We talked about the fact that the range of the needs of the kids as they come back are multifaceted. They're on a full-time schedule. They haven't been on that in a year. Obviously, a different personnel. We talked about the acceleration class and how that's been such a success. I think we said we had around 200 kids last week.
Correct. We'll have around 200 in total incoming kindergartners,
Yeah.
and then about 60 students in the math,
That's
which is running this
That's
week.
great. Previously, individual learning was much more of a SPED focus, but it's sort of broadened into the gen ed at this point in time, so we're working on that as well. Talked about the WIN program, What I Need structure. I couldn't remember which grade level we started.
Elementary.
Elementary, thank you.
There's a heavy focus at the elementary level this year.
So I don't know, Kara, if you want to just spend 2 minutes talking about the WIN.
Yeah, that's something that our elementary principals have been collaborating around, just looking at the elementary schedules this coming school year, trying to build in time for students to get what they need. That's why it's called What I Need, related to literacy or math skills, and to have kind of a flexible grouping structure to provide what we would call general education additional support.
Great. And they meet 2-3 times a week in general?
That's a great question. I know that the elementary principals will fill you in on this. They're focusing on this topic within their school improvement plans at every level. So more to come. I think we'll be talking about that later in September. I just don't want to misquote, but they'll give you that schedule
that's absolutely fine. And the idea is there are certain things on our wish list that may require no budgetary dollars, resources, whatever you may, and we'll try to work forward on some of those. But in some ways, we need to prepare for next year. If there are things that we need to build a case, get more information about, so that we can then perhaps include it in next year's budget, then we can make progress on some of the wish list items that the three of us have come up with in conjunction with administration as well. So, and we have to talk to we have to understand what we have now, what the principals are looking for, and once again, how do we prioritize those and factor in the whole school improvement program into that as well. So there's a lot of aspects of this in trying to come up with programs to improve in this area. So much more work to be done, but it was a very, very interesting conversation. Did I miss anything? Amy and Amy, as I like to say. Or Doug or Kara?
No, I think you covered it.
Got it.
Good.
Yeah.
We missed having you take the notes though, Judy, because I'm a poor replacement for you. I apologize for that.
Thanks, Mike.
Yep.
Kevin.
Yeah, thank you. The Policy and Communications Subcommittee met a week ago today, August 17th. We had a pretty full meeting, starting with, of course, the topic which we all have talked a bit about today, the face covering. So we talked about that. Ms. Wall joined us as a general member of the public and shared with us, as she had brought up at the retreat, some feedback and some suggestions for us to consider in regard to the amendment that was passed, or the resolution, sorry, that was passed last spring in regards to the logo. We then also, Ms. Ingalls had taken on the duty of drafting a potential logo/mascot policy, so we just started to review that. And will be something we'll revisit in the future. So that's what we had covered. Didn't get as much of a chance to talk about communication, so we'll do that. We also talked briefly about, we've been talking for quite a while about potentially contracting with MASC for a policy review, policy hosting. So some additional questions that I think the subcommittee had, the superintendent answered, and I think where we ended up is that we'll invite Dorothy Presser of MASC to maybe give a little bit more information about what the service is, how it works, the benefits of, and for us to consider. And we'll be planning on probably meeting in 2 weeks to follow up on some of these agenda items.
Great. Thank you. Next on the agenda is future dates and agenda items. So our next school committee meeting is September 14th. Coming off of our vote tonight, and in speaking with Ryan from WCAT prior to our meeting beginning, we'd like to ask that everybody start wearing masks for our meetings. So we're going to start doing that as of that meeting on the 14th. I think that's it for, well, does anybody have any agenda items that they would like us to focus on at that meeting that we should consider? I think we're going to have a lot to talk about, considering that school will have started.
What day does the Policy and Communications Subcommittee plan to bring the logo policy, creating not my thing, the logo, to the whole?
Yeah, I don't know if we have an exact
Date
timeline
yet.
for that
Okay.
per se. It will be on the agenda for the next one to further discuss.
Okay.
And in fact, if and when we're at a point where we want to present it to the whole group, we certainly
Okay.
will. But there's no prescribed date.
Okay.
So we'll move to school committee comments then. Kevin?
So our next meeting's the 14th, is that what you said?
Yep.
So well after the start of the school year. So just want to wish everyone well, particularly the superintendent mentioned some of the new members joining us as teachers. So welcome to Wakefield, and look forward to potentially having an opportunity to interact at some point. I have a nephew who participated in the kindergarten experience and had a wonderful experience getting in the doll bear, meeting his teacher, talking about Mr. Liberty. So I thought it was really cool. It sounded like a really great program, and really excited about that. I really do hope it is potentially something, especially if the outcomes are what we want them to be, And anecdotally, it seems like it is. But if those outcomes are achieved, it would be wonderful if it's something that we could continue. And hopefully the similar outcomes for the 60 students in the math program, which Kara said they weren't as excited about, but I don't think anybody
Quite the same.
So, but thanks to everyone to put those efforts together. Thanks to the staff and the faculty who have been willing to come back and to work and take a little bit of their summer to prepare our youngest students for this upcoming year. So we're really excited about that and look forward to getting going in the school year.
Amy.
I just wanted to thank all the parents or community members that sent us emails since our last meeting. I enjoy hearing the perspective. It always opens a new door of research for me, and especially the ones that came out tonight and spoke publicly. It's not easy to sit there and have, 11 people just staring at you. So, and not everyone had great comments. So I just want to thank everyone for their participation.
Amy?
So last night or 2 nights ago, I had the opportunity, a couple of the other members had gone to the Metco open house. It was really great to hear Glavia speak and to meet some of the new families that are coming in. So I'm excited to see some of those programs that they talked about and welcoming the new students and families. And what else did I have? I hope everybody has a great rest of their summer and a great first day of school. And thank you to all the teachers and families.
Thanks, Amy. Mike?
I just think it's really exciting that we're having kids back full time. I mean, take a moment and appreciate this. We have so many things to work on, but, here's one that, we're going to see materialize. A lot of work has gone into it. A lot of work will go in going forward. So, particularly for the administration, I hope you had a few good summer vacations because those are probably over now for a while. So, but I hope you got a chance to recharge a little bit, and thank you all for all that you do for us. We appreciate it.
Stephen?
Yeah, I would mention about the vaccination clinics coming up. Our Thursday, August 26th, and Thursday, September 2nd. They're 1 to 5 at the high school field house. So take advantage if you can. I did also attend the Metco open house with Amy. That was fantastic. Really great to see all the families and see some of the new families that are getting into the district. So excited for the start of school, and also thankful that all the community members that have come out and reached out, because I thoroughly appreciate good civic discourse, and there's been plenty of it. So it's always part of the process and helps to make us informed. So appreciate it.
Thanks, Stephen. Tom?
Certainly just want to add on to thanking all those, as Amy said, all those who wrote emails and those that stood out tonight and those that came and shared views, regardless of what side of the issue you're on. That conversation is an important part of the community at large. So I certainly appreciate that. I wish everyone winding down the summer, wish everyone a good couple days or weeks, if that's possible, left. And we hope the faculty and staff had as good a summer as possible, and just thank them for getting ramped up and enthusiastic about the new school year. So thank you. Thanks all.
So I actually have a few things, and I know we're late already, so I will try to keep this short. First, I wanted to give an update from my Environmental Sustainability Committee liaison that I play. I need to send an email to both the Finance and Facilities Committee chair, which is me, so I'm not going to email myself, but Policy and Communication Subcommittee regarding a vehicle vote. There's something related. Now I'm tired, so excuse me, I'm not going to get all the details right. But as part of being green communities, there's a piece of that where we're going to potentially need to purchase vehicles that are energy efficient if we have any vehicles. I think we've had some conversation about this in the past. I don't believe that we have any that qualify, but we need to have some conversation about that. There's also a policy that has to be reviewed and voted on, Kevin, that I'll get over to you. So I just wanted to give everybody a heads up that that conversation is coming our way. The other piece of discussion that applied to school committee at that meeting was a lot of discussion about the high school project, how that committee would like to have some input in on the kinds of things that we should be thinking about from a sustainability perspective. And they all kind of know the best that that there's going to be opportunities for them to engage as part of the public. We also talked about maybe them being able to engage specifically as the committee. So those were the two main topics that I would say applied to this group. I also want to talk a little bit about the Metco open house. Only because, and I'm embarrassed that I don't know the gentleman's name, but for the first time I got to see the Galvin, Dwayne, thank you. So Dwayne was there, and he is our Galvin resource, academic coordinator, and he is a hot ticket. I really enjoyed listening to him speak, and the next time Glavia comes and speaks, we need to make sure that we have Dwayne join us. I was really excited to kind of hear him speak, and I can just see how the kids must love him, especially at that age. So I was super excited I didn't get to actually meet him because I didn't realize who he was until it was too late. But it was really nice to see him and hear him speak. As all the others noted, I also want to say thank you for all of those people who've sent us emails, the people who showed up tonight. It's important for us as committee members to hear all the different sides and different perspectives. And as Amy said, the emails and hearing people speak always causes you to kind of pause and think about things differently. So it's really important, and I want to thank the people that take the time, because it is time consuming to sit down and write an email or to show up and speak. I'm going to close on the fact that I'm slightly embarrassed to say that I've never been to a marching band performance, even though I know Wakefield has this amazing marching band. My daughter is going into high school, has a good friend who's in the marching band this year, and she was over at our house and she told us, hey, on Friday night they're going to do this kind of run through. My family can't come. I'd really love it if you and my daughter come. And I was like, of course, that sounds great. And so I go up and on Friday night, and there's a ton of people there, first of all, which was very impressive. And what they did was walked us through kind of all of the things that the kids had been taught over the last 2 weeks, where they have very intensive band camp, and walk us through kind of the thinking. Mr. Banker kind of MCs the show, but I was really impressed with the number of folks that help out with that event, how many of them are Wakefield alums, and that come back and just help with that camp. The performance was amazing, but I think the most important thing was, I'm going to get a little bit emotional about this, is my daughter's friend said to me, I have found my people. She's heading into high school, and she is like so excited and just genuinely jazzed about going to school, about seeing these kids, feeling like she's got a place. And this is a kid with a complicated background. And, she sent me a picture of her and Mr. Morrell. I could go on and on about this interaction. And I know we have a special music program in Wakefield. I've always known it, but I got to see it, and I got to see it through the eyes of a kid who I really care about, and that I think it's going to make a real difference. And it's not about music. It's about feeling like you fit in. And so kudos to every single person that was involved in that band camp. I know it's a tremendous amount of work. It's a lot of hours. It's really hot, and it's making such a difference for kids, and I didn't want to let that one go. So that's it for me. I think we can adjourn the meeting, Mr. Markham.
I make a move that the school committee adjourn its meeting of Tuesday, August 24, 2021.
Second.
Motion made and seconded. Discussion? Seeing none, all in favor? And we are done.